Test, test. Is this on? My light's on, but I don't hear myself. You guys can hear me? Oh my gosh, I can't hear myself. I'm gonna do it without glasses. Okay, ready? Good morning. I'd like to call this meeting to order. The time is 9:31, and today is Thursday, December 9th, 2021. This is day one of the Physical Therapy Board of California's two-day board meeting. We're meeting at the Department of Consumer Affairs hearing room located at 2005 Evergreen Street in Sacramento. Could we please have roll call? Here.
Large portion of that training. I'm going to encourage a number of my staff to attend it with me. And this is that regulatory training where I've kind of told you guys in the past that sometimes when I go to it, even though we're from the largest state in the union with the largest licensing population, we feel outnumbered a little bit because some of the other states bring sometimes their whole boards. So the more board members I can get to attend with me, the better. And I think we can help them hit that 35 threshold pretty quickly. The next available alternative to that isn't going to be until May. And right now it's up in the air if that May meeting is going to be in person or also remote.
That was going to be my next question because I thought I saw something that they were looking to have an in-person event.
Yeah, and I think in strategy moving forward, that's going to be the idea is that even, knock on wood, in a post-pandemic world when we get there, I think Fsbpt has kind of learned from this experience that providing both, providing a remote ability to attend and an in-person, once per year each would get better coverage.
Dr. Dominguez, any word on life or the annual meeting being in person?
That's the plan. So I'm looking at the life meeting is scheduled potentially in Alexandria, July 23rd to 24th. And then the annual meeting and delegate assembly will hopefully be down in Orange County here. In the
Yeah,
state.
we'll be the first to know if it's going to be in person for the delegate assembly as we'll be hosting.
Okay. Thank you. Are there board member comments or questions regarding FSBPT issues? Any public comment on FSBPT issues? Okay. Agenda item 19B, DCA. Is that correct?
Yes. We have Brianna Miller with us from Board and Bureau Relations from the Department of Consumer Affairs. Welcome.
All right. I feel like my daughter is a toddler sitting low. Okay, well, good morning. I'm Brianna Miller. Can everyone hear me just fine? Okay. I'm Brianna Miller with Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me an opportunity to provide a presentation to the board today. To begin my update, I'd like to first discuss COVID-19 safety measures and telework. DCA appreciates board members and staff who have continued to serve through a pandemic that has affected all of us in many ways. We are working together to find the right balance of staying connected and productive while keeping safe and healthy. DCA and its board and bureaus continue to look to the future and use lessons learned to identify long-term efficiencies and policy changes. Staff are working in the office to provide the most effective consumer protection and public service while also utilizing telework where appropriate. Next, I'll discuss testing and vaccination verification. To combat the spread of COVID-19 and protect vulnerable communities, California has implemented enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination or be subject to regular COVID-19 testing. DCA's testing program kicked off in early October with the launch of the DCA Headquarters 1 pilot site. Select programs are designated to test at Headquarters 1, and the list of programs recently expanded due to the capabilities of the site. Board members must follow health and safety protocols when visiting a DCA location or attending an in-person board meeting. As a reminder, Sacramento has an indoor mask mandate, and all staff, members, and guests must wear a mask covering the mouth and nose at all times. Additionally, visiting members must verify vaccination or follow testing protocols. And as you demonstrated for this in-person meeting, DCA requests that boards communicate plans for in-person meetings as soon as possible so that DCA can assist with the coordination of teleconference options for the public, vaccination verification, and COVID-19 testing. Next, I'll discuss remote meetings. DCA recognizes the difficulty of planning for future meetings as the pandemic continues to evolve. As the law stands today, remote meetings are allowed until January 31st, 2022, after which time meetings will be in person in accordance with all aspects of the Open Meetings Act. We don't know what additional changes to the law may be coming, but I think we all recognize there are benefits to remote meeting options such as increased public participation, cost savings, and a lower carbon footprint due to reduced travel. DCA encourages boards to continue utilizing remote options for public participation when possible. Additionally, for hybrid meetings, which is a combination of in-person and WebEx, DCA can provide technical support at DCA Headquarters 2 location. We will continue to keep you updated on any additional changes to meeting requirements or technical capabilities for meeting formats. Finally, I'd like to provide you with a reminder about required board member trainings. And that reminder is that 2021 is a mandatory sexual harassment prevention training year. This means that all employees and board members are required to complete the training during this year, which, as we know, is rapidly approaching its end. You can access this training through the Learning Management System, or LMS for short, which is DCA's training portal. You can also register now for the Board Member Orientation Training, or BMOT, in LMS. And we're happy to report that 2022 training dates are now available. Virtual trainings will be held in March, June, and October. This is a required training for newly appointed and reappointed members, but we also encourage it to any member who seeks a refresher. Board of Your Relations is also happy to assist you with any questions or concerns you may have about these trainings or the use of LMS. And that concludes my presentation. As always, Board of Your Relations is here to help, and if there's anything we can do to assist your board, please do not hesitate to reach out to us. Thank you for your time.
Thank you, Brianna. Any board member questions or comments for DCA? I think we are not doing the hybrid today because we don't have the capability here, correct?
That's correct.
Is DCA looking to get that capability here so that when we have our next meeting, we'll be able to do a hybrid?
I know that DCA's communications team is looking into several options to accommodate boards and bureaus, but right now it is DCA Headquarters 2 that supports it.
I don't know if this is okay to ask, but could you please relay to DCA that we would very much like to have that option here at the Evergreen building so that we wouldn't have to go to, headquarters. It'd be convenient to have it kind of here at home. Yeah, thank you, Brianna. Anything else?
Just to add to it, we've been in constant contact with DCA since we realized we weren't, capable of doing the WebEx hybrid here. And as part of that discussion, one of the things that came up was modernizing this room to allow us to do it is not just beneficial for us and our ability to have a meeting here, but it's also kind of beneficial for all of the Department of Consumer Affairs with, 38 boards and bureaus inside of DCA. Having to juggle between 2 Sacramento locations that have that capability can be difficult. And so adding a 3 just adds another divisible. And so I think we'll have their support and we'll be able to get that done.
Great, thank you. Okay, thank you, Brianna.
Thank you all.
Thank you.
And we have 19C, CPTA. Welcome back.
Thank you. It's nice to be here.
Yes.
Nice to see all of you in person. I'm Stacy Defoe. I'm Executive Director for California Physical Therapy Association. And again, I'm just really happy to be here and to see all of you in person. It's been a long couple of years, I think. But I will say we have enjoyed the, online meetings. That has worked well for us as well, and so we appreciate you working to provide those over the last couple of years so that the community can participate. And we would be in favor of hybrid meetings going forward as well. Just a couple of updates, not much from the last time we were here. Again, we are back in person, are planning to be back in person for our annual conference in Anaheim on September 24th and 25th. We will have an in-person exhibit hall, and so we would like to again extend an invitation for the board to be present and have a booth in the exhibit hall. So if you're interested in doing that, we hope you will. You can reach out to Rita Pearson in our office, and she will work with you on that. In July of this year, Jason Kaiser participated in our webinar Wednesday, which were developed during the course of the pandemic to provide education for California PTs and PTAs. Jason participated on July 28th. That focused on continuing competency Q&As, and then definitely ran into more general Q&As. Jason did a fantastic job of representing the board. He presented the information in a digestible way and addressed a myriad of questions. If you weren't on there, it was pretty impressive. So we appreciated his participation and want to extend the invitation again this year to participate in a webinar Wednesday. I believe there's already been some conversation around that, so if there are topics of interest to you, we may have some topics going forward, but you can communicate with Rita again in our office, and we'll find dates and times to do that again if you're interested. Just want to extend appreciation to the board, to Jason, the executive officer in particular, for establishing ongoing regular communication between the presidents and the executive staff of our organizations to exchange information regarding issues that we have related to the profession and priorities of the organizations. We feel that that has been a very beneficial line of communication, and we look forward to seeing that continue. And as well with the executive officer, executive director and staff to discuss legislative issues of relevance to both organizations, to PTs, and to California consumers on a regular ongoing basis. So that's been very helpful, and we look forward to seeing that continue as well. Just a reminder, again, we're celebrating 100 years of APTA this year. On a side note, this is also 50 years of CPTA. CPTA was established in 1971 formally as one organization. Prior to that, there were 4 district organizations that came together to form the California Physical Therapy Association. So it's 2021 is the CPTA 50-year celebration as well. So we are celebrating all of that and the power of physical therapy at the Rose Parade float on January 1st. And so we hope you all tune in and watch. We have solidified for the most part our list of who will be on the float and who will be walking, and it's a great list. Really shows the diversity of the population that you all work with, and the power that physical therapy has in everyday lives. So we're excited about that. And then finally, we just want to again extend a thank you to the board and the executive officer, Jason, for your open door policy over the past couple of years with communication. There have been a lot of questions both ways, I would say, but mostly this way to you. And so we appreciate your willingness to accept all of the phone calls, emails, and from our staff as well, and just help us address the questions that have come up over the last couple of years. We really appreciate that and look forward to 2022.
Thank you, Stacy. Questions, comments from board members?
Thank you so much.
Thank you.
Thank you, Stacy.
Okay, I think we're going to pick up with agenda item number 5. regarding sunset review. So we're going to get into the meat and potatoes now.
Let's do it. So just a brief kind of explanation of a little change in plans and the way that we're gonna do things. We are asking the board members to kind of follow along on your laptops with the versions of the document that you received last week. And as we go through the document sequentially, please, share any of the edits or recommendations that you'd like to in discussion. Brooke is driving the document and she'll be capturing those edits real time. And we provided this display mostly just so that we're keeping track and we're all on the same page, and also that so you can see that those edits are being captured real time. I'm sure that through conversation we will get to areas where we can't quite capture the edit in its entirety right then and there, and so we'll put a side note, and there's an opportunity for staff and I to go look at it this evening and then come back tomorrow to make sure that we've got it just the way the board wants it. But our intent, by close of business tomorrow, is that you as members are comfortable with the report to essentially sign off on it and adopt it. And what we're asking is in that sign off is that similar to a motion that is kind of like our regulatory packages, that you delegate to the board president and the executive officer to make any kind of non-substantive changes as a result, as it is to formatting, grammar, spelling, that kind of thing, so that we can clean it up a little bit before we submit it. We plan on submitting it to the legislature on the deadline on January 5th. There is a beautification process of the report that we're going to be using with DCA's public design and editing, if you will, publications design and editing. What you see in front of you is the draft of the sunset cover for this particular year. So we're also open to any kind of critique or commentary that you have about that, because again, it's just draft at this point. So, and with that, we can get into the report.
Okay, a couple housekeeping items. Sal, do you need to jump in? Yeah. And secondly, I'm wondering, the screen is great for board members, but I'm wondering if it can be repositioned at all. So does the audience need to look at this larger screen, Jason? I'm sorry.
It is for just following along, so we can tilt the screen a little bit more as long as it doesn't take the view away from the members and being able to track as well.
Okay. Would you all like to tilt it a little, the audience members, so that you can see it? Tamika, you'd like to see it? Okay.
Oh, you sure? Push it back just a little bit.
Thanks.
You and Tanya can see it from there. Oh, okay. Is that a little bit better for the audience?
And for members, if at any time, we get lost or confused of where we are, just ask and we'll.
Thank you. Okay, I think before we start, the only other thing I'd like to say is thank you very much to Tanya, Jesus, Jason, all staff. A lot of work went into this, I can tell by reviewing the materials. So in advance, just thank you for your hard work on putting this document together.
I just want to echo that because, especially to Ms. McMillian and Dr. Dominguez, we took quite a bit of time commitment from them, and they were there and uncomplaining and contributing and understood the weight of the workload. So thank you for your participation. Staff really appreciates it as well. So one of the things that we wanted to add to this particular document, in having discussions, some of the things that I was tasked with by the board was to reach out to some of our stakeholders like the California Medical Association, the California Physical Therapy Association, and in conversation with those stakeholders and DCA, and then even here at staff, we realized we have more acronyms than we know what to do with, right? And so for the purpose of making this as easily digestible as possible for ultimately who should be the end, the end user of this document is the public, and so I want them to have ways to reference what we mean when we say things like CE or AGPA or SSA or those kind of things. So we decided to make a definition key. Ms. Beauchamps helped us with this as well. And one of the things that we didn't really imagine is that it would go past one page. But we have an alphabet of acronyms. And so we have, I think it's 4 pages now at this point. So exit contribution. One of the things that is missing from the document, but it's a little too early to make, is just an index. So we'll prepare that once the document is finalized. And so starting with section 1, the background, a lot of this is for a good part based on our works in the last sunset. Was very complete and comprehensive, so we used quite a bit of that material and just provided updates throughout the document to span the last 5 years. And so in this review, as we go page by page, if you have any kind of questions or concerns, please share. What we are looking for here is more content than style, though. So if you think it's not quite how you would have written it, I understand, but we are on a very kind of truncated schedule. And so hopefully style can be accounted for.
So in that second paragraph there, legislative amendments occurred between 1971 and 1996, transferring administrative oversight from MBC to PTEC. I am wondering if the transfer happened in both of those years to PTEC?
Actually, it's kind of gradual over time.
Okay.
A little bit of authority as legislation changed over that period.
Okay.
And in 96, complete autonomy.
Got it. Oh, that makes sense to me now. Thank you. And my comment about paragraph 3, the third sentence there, governor appoints all professional members. No problem with that. It's just that I believe there was another place somewhere further down the document where we referred to professional members as licensed members, and I'm just thinking we should probably be consistent. A little nitpicky, but
Sure.
yeah.
No, that's a good point.
Yeah.
And those are the kind of things for consistency throughout the document we would consider part of the style
Okay.
guide. So what does the board prefer? Would you rather, in these instances, to be licensed members or professional members?
A professional is somebody who has autonomy over and authority over their practice. At that point, I believe we were still under the autonomy, under the authority of physicians. So I would suggest we continue with licensed at that up until that point when physical therapists no longer were under the authority and had their own professional capacity.
So there's kind of a timeline component to this of when it's being referenced.
Yeah, I would suggest that.
Okay. And so anytime that we're referencing the current composition, 96 and post, we would use the word profession.
Okay.
Okay.
Thank you.
Just to ponder on that a little bit more, it may be better to go with licensees because this also includes physical therapist assistants as licensees.
This is for appointed board members who are licensed.
Yeah, so when we're referencing the authority and the appointing power that the governor has.
Just for consistency throughout all of it, I'm thinking licensee may be the more appropriate terminology, just so that to reduce the potential for confusion anywhere through it.
Mm-hmm.
If we just continue to use the word licensee, because then that applies to everyone all through the time.
I think licensed is a more, a stronger clarification,
Mm-hmm.
but
Board, mm-hmm.
I'm okay with the other.
Any public comment on that? Okay, thank you. Board members okay with using licensed? Yeah.
Yep.
Okay. Functions of the board, I have, let's see, where did I make this comment? Can't find it. Oh. Here it is. Second bullet from the bottom. Appropriate action is opposed on licensees who are found in violation of the act. Again, a little nitpicky. I try to remember that we take action on a license and not a person. So I don't know if we want to consider a change here or if it's fine the way it is.
No, I think that's a very good point. I would encourage the use of licenses and not licensees. Moving on to the next page.
Physical therapists provide services to individuals and populations. Can we clarify populations?
Populations, I think at the time was in reference to different demographics. So whether that had to do with age or health qualification or even location. So you would have a geriatric population or a pediatric population or a sports injury population.
Okay.
And that's also language from the previous sunset.
Yes.
Could I suggest just modifying it with diverse? Does that help? Diverse populations, that sort of like captures.
I
a
think
broad
so.
range?
I think so because I was thinking that as a physical therapist, I don't provide services to populations, but yeah, diverse populations might help me. Any other thoughts from board members? Any public comment? Okay.
Nothing else for page 6. Moving to 7.
Let's see. Actually, same paragraph, second sentence. This includes circumstances where movement and function are threatened by aging. I kind of struggled with that a little, but maybe some clarity on that.
The word threatened seems like probably, to me, seems to be the most challenging word there. Maybe impacted
Impacted?
instead of threatened. Impacted by aging, injury, disease, disorder.
Thank you. If there's any public comment as we go along, please feel free to stand and come forward. Yeah, just come on up. I'll keep asking, but feel free to just come on up. Okay. All right, so. Okay, here's where I'm struggling a little as well. The second bullet there, physical therapists are professionally qualified and required to evaluate the findings from the examination slash assessment to make clinical judgments regarding patients and clients. Actually, I think it's okay. I think the first time I read it, I was thinking that we weren't making clinical judgments regarding the patients, but about their health condition or. Are you in agreement with that, Jesus, or can you offer any substitute language, any members?
You know, I think I get what you're saying. We're not making judgments on the person.
Right, right.
Their personal characteristics, but more along the lines of their health condition. You know, probably tweak the language a little bit. I don't know what. Regarding
their patients' and clients' health and well-being.
Yeah, I was gonna say health status, but health and well-being is. Alicia, does that?
Yeah. Others? That's fine.
For me, I think the word clinical takes care of it.
Uh-huh.
Yeah.
But
Too.
I'm not opposed to adding health and well-being or something like that because I think clinical does that. And it took me a moment to think about because at first I was thinking about just movement. But then in considering cases where I'm working with a patient who has other issues going on and others have not identified them, that I identify and I make referrals to.
That's right.
To the next. So I am using clinical judgment at that point about what's appropriate for me to work with. So I'm good with the way it reads currently.
Okay. And you're, come on up.
Are you adding clinical?
I think it's already
It's
in
there.
there.
Stacy.
So clinical is later in the sentence right before the word judgments.
Okay, thank you.
So on document page 6 in
Yeah, I was looking at the first one.
the bullet list. Yeah.
Ah, I see. So Dr. Drum, are you okay with adding patients' and clients' health and well-being?
I don't think it makes a significant impact. If others want to add it, I don't think it doesn't change it all that much for me.
Okay.
The only reason I would recommend adding it is, just our biases and understanding of clinical, and then again, trying to keep this at the audience level for the public. I think that addition of health and well-being is helpful.
You agree? Okay, thanks, Tanya.
Anything else on page 6?
Oh, I thought we weren't going to be able to make the changes in real time, but you are.
We are.
Huh, good job.
There's always a plan D.
That's great.
Moving to 7.
Yeah. let's see, 1, 2, 3, 4 sentences above the table. The sentence starts, "The committee consists of 2 board members, 1 licensed and 1 public member." So consists with of 2 board members, 1 licensed with a D, probably. That's it. Other than that, this is talking about committees, correct?
That particular question, yes.
And so would we include the Sunset Committee?
We debated quite a bit about that, but this has to do with committees that were asked for the time frame of the report. And because we put the Sunset Committee outside of fiscal year 2021, we left it out. It'll be captured in the next sunset.
Okay, thank you.
The particular committee that this paragraph is addressing is about the EO exempt level,
Correct.
not other committees such as Sunset.
Were you in thought, Dr. Drummer?
For a moment,
If I,
then I thought better.
I was just going to make a quick comment, just a suggestion. The last sentence in that section, the PTBC has not identified the need to establish any permanent committees. Maybe that goes out to start. So we haven't identified the need to establish any permanent committees. However, in September 2018, would that read better?
Mm-hmm.
I think it would.
I think it would too.
So for the board member attendance chart,
Yes.
this has been updated with all of the new information, dates, and different members. I anticipate this one will probably stay this way. We were going to ask PD&E to kind of take a look at it and see if they could, make it a little bit prettier. But really, when you think about it, there's a lot of data going on here, and so we'll see what they can do. So if it does change, it won't change much. It'll just change essentially in design.
Was this table template given to us, or was it something we created?
We created it.
I'm wondering in the title, board member attendance, can we consider changing it to board meeting attendance by board members? Am I getting a little too
No, I
in the
think-
weeds?
I think we certainly can do that. I'll have to make that notation on the side because that's an actual capture, so.
Dr. Drummer?
I think, pardon me, I think that helps to clarify what it is we're attending.
Thank
I
you.
would agree with that.
Thank you.
If I left the title as board meeting attendance and where it says name, if I actually put over the column name, board members.
Mm-hmm.
for
Yeah.
simplification, okay.
Yeah. That'd be good.
And anything else for that particular?
Just some questions.
Sure.
For Deborah Alviso, she has this great track record and then 4 dark gray boxes, and then she's back for 2. I don't remember that happening, but my memory could be wrong.
We'll verify that.
Okay. And then similarly with Mr. Turner and Miss Wallish, we've got a bunch of non-applicables, but then they were present just for one meeting.
So that is, yeah, we'll have to verify that as well.
You know, you had at one meeting, not too long ago, other members might remember, you had a beautiful chart that did something very similar.
So the chart that you're referring to is about your appointments and time.
Yes.
It didn't really touch on
Yes.
actual meeting dates and that kind of thing. And that's why I said there's a lot of data here as far as the vertical columns that list out all the different locations and the dates.
Yeah.
And trying to specify that. But that look that you're referring to that Brooke created, just to track the appointments and who came in and who left, and so we could, really kind of draw a sense of urgency to those vacancies that were coming to a head. That style, if you will, is what we're trying to apply to this graph through PD&E, but we're gonna need their assistance to do it.
I see. And I know time is of essence, and I'm just wondering, like, the dark gray vacant boxes, might we want to consider that for like Dale and for, even Mr. Turner, Miss Wallish, Mr. Irvin, for the time period that they were no longer appointed? Because it's just looking, I don't know. Am I the only one who's, am I the only one who's confused a little bit?
So dark gray would be that they were supposed to be there, but they weren't.
Including Deb?
Actually, I'm sorry, dark gray would be the vacancy itself. And so that's why I need to check on Ms. Alviso's and why there's that kind of tile in, if you will. And the same thing for Mr. Turner and Ms. Wallish is those colors. We'll just have to verify. The chart that we have with all these dates isn't quite so pretty. We'll just make sure that it's accurate.
Sure.
And Jason, also for TJ, I think we have him vacant and then back and then vacant again.
Yeah. There may be some jumble in the shading, so we'll just make sure that that's accurate for all the members.
Yeah, I'm thinking for Miss Armstrong and Mr. Irvin that, it should be vacant all the way up until they were appointed. And then light gray if they, yeah. Okay, thank you.
I'm wondering if it might be possible to adjust the columns, because the way it reads right now, the latest date starts the fiscal year part and it breaks it for each separate fiscal year. Potentially we could just have it be a continuous flow of fiscal year, because I think that actually may be the part of why some of this is jumbled, because we have the start of a fiscal year through the end of the fiscal year, and then we do that all over again for the next year. And then for the next year, we run it July to June again.
Mm-hmm.
Instead, if we could run it from right to left,
Right.
earliest time period to most recent meetings, that I think might help the read a lot.
So fiscal year 16-17 to the left, 2021 to the right, reading from left to right.
And then starting with the first meeting of 16
Got it.
and then just so the calendar continues to roll through.
Yes. Yeah.
Because right now the breakup is it's strange to read it. And then it looks like fiscal year 2021 is not complete, if I'm reading correctly. We have June, we have September, and
I think that's actually a matter of just a cutoff. When we did the insert into the document, I think it cut it,
not enough space.
yeah.
I mean,
And so we'll make sure that.
so, yeah, which is more important to have, the most recent ones or the oldest ones?
Mm-hmm.
And I think that adjustment in the calendar part is part of why we see with Dr. Alviso,
Mm-hmm.
the dark gray.
Because it breaks. We don't have the dates above it in sequence.
Right.
I agree. Yeah. We'll tweak that to make sure that it's much more easy to understand. On to the next chart.
Mm-hmm.
Okay. This one's a little bit easier to understand.
If the year could be included in the column date first appointed and then date reappointed, because all I'm seeing is day and month.
Yeah, the dates should be sort of uniform, standardized.
And instead of instead of letters from an alphabet, standardizing to the numerical one.
Is this also our chart, or was it a table template from?
This is a template that they provide that we fill out, but we are and have been given latitude to, to alter them to a certain extent as, till we see fit what better delivers the information.
So I'm wondering if we want to consider the last column to be public or licensed.
I think based on the decision we made earlier to refer to license, I think that's completely appropriate.
Okay.
And just to allay any concerns that may float around, this is only language for this document.
Absolutely.
Yeah. That we're not intending to change any definitions for any place else.
Is there any particular order that we were following with listing members and their appointments? Or even if there's not, should there be?
It's kind of a combination of governor and then Senate and then Assembly,
I see.
but then also reappointments to not take it out of time sequence too much to keep it understandable, but we could prioritize those lists however you like. If you want all of the governor appointments first, and then Senate and Assembly after, that's fine as well. I could alphabetize by board member too.
I'm open to what the board members prefer. I'm just thinking chronologically myself. And I see, Miss Alviso there in the middle. you know, I don't know, what do you think, Daniel?
I would
Dr.
lean
Ryan?
more towards date of appointment, yeah. If we revise the dates, the recording of how the dates are recorded, and then sort it by date of
And-
appointment, I think that would,
And they revise it by date of first appointment, correct?
Date first.
I guess I am trying very much to read this from the lens of the audience and make sense of it. So I guess I would think that those who are no longer serving would probably be at the bottom.
When you're looking at, it's kind of that capture in time zone.
Mm-hmm,
So like with Ms. Alviso as an example, where she's no longer with us now,
mm-hmm,
she was with us for that initial stage of this capture in time.
yes,
And I think we had kind of conversation and trying to decide who goes, where. But
yeah,
I think that just that direction of utilizing the date of first appointment, even though it puts her towards the top, I think throughout the rest of the document, people will get the idea that, she turned out during that period of sunset time.
What if we used date that, it went in the order of the date that the term expires? Well, reverse order.
So putting the newest expirations on top.
Yeah, so it looks like the first two are correct. And then when we go to Ms. McMillian and Mr. Irvin, right, in 2023, expire next. And then Mr. Drummer and Dr. Drummer and Dr. Dominguez would be, I don't know.
Interview resignation.
Yes, is that?
I like looking at this, I think that would be easiest to understand, and you can see. And then you have people whose terms expired and at the bottom, people who are still.
Thank you, Stacy.
We have consensus on expiration.
Everybody good with that?
except that we need to correct the information for Dr. Armstrong, because it says that she expires June 1 of this year, 2021.
That's actually true.
Is
So
it?
she's already in her grace.
Oh. So she came in the middle of a term.
She came in the very last year of a term. She's already expired. She's now in the grace of that term.
At the last meeting of the term?
Yeah.
Was she with us in June?
And
So she was
we're waiting-
appointed and then and her term expired.
And her term expired because she came so late into that appointment. And we are now waiting on her reappointment.
Okay,
So the data is correct.
okay.
And we're thankful to have her.
And hope to have her for a while.
That's right.
Yeah.
Thank you for your service.
So we'll make the notation to do it based on date term expires.
Yeah, and you mentioned that other beautiful table that I was referring to, earlier. I don't know how that was laid out, but I really liked it, and maybe there's something in there that can be valuable to use toward here.
Yes.
Oh,
Staff made a comment that if there was a possibility for maybe an explanation of footnote, because Daniel, when you said that, how the term ends so quickly, it's going to look like that. When you enter the data, it's going to look like he just was in term for that short period.
mm-hmm. I'd be in favor of that, a little asterisk and a note.
Yeah, potentially indicating who's in grace.
Thank you, staff.
So back into narrative for questions. Question 1 is rather matter of fact. Question 2 does have some new language in it that talks about reorganization and change in leadership for the board. Any comments on page 9?
Yes. When did we move to level N? What was the date? That's new since the last sunset, correct?
Yes.
Would we not want to include that here in this area, this section?
We do in another section, but we could put it here as well.
I mean, it's specifically asking for reorganization and change in leadership. I'm thinking the reason why we were able to appoint an AEO is because we moved to a new level, right?
Correct. Anything else in the change in leadership?
Oh, yes. Public comment? Staff comment? Yes, Carol?
The second paragraph on page 9, references a professional member to the licensed member.
Page 9.
And we'll do a find and replace on that as well.
Thank you.
In the first sentence about relocation, I'm wondering if maybe just to me, it's a better clarification. The PTBC had surpassed its capacity of office space rather than reached it,
Yeah.
because converting closets into workspaces to me surpasses the capacity.
I'd appreciate it if we don't talk about that kind of stuff. We've got nice digs now. We've made the note though.
Thank you.
We certainly surpassed it.
Yeah.
We're ready to move to bunk desks.
Yeah.
2-story cubicles.
So strategic planning, if I may read that first sentence. In 2018, the PTBC established and adopted a multi-year strategic plan identifying goals and objectives to address issues and trends impacting the profession of PT and business practices. I am wondering if that's indeed what we did. Do our objectives address issues and trends impacting the profession of PT and business practices?
How about the regulation of PT?
Yeah, thank you. So how would that read then?
I'm simply swapping out the word profession with regulation.
Okay.
Therapy and business.
Impacting the regulation of physical therapy and business practices. Are members okay with that?
Was that just in 2018?
Yes, it was.
Was it really?
We're gonna start it again next year.
We hadn't done it before?
You have done it one time before that.
Yeah, I kind of thought it was earlier than 2018 as well.
So I'm wondering if,
The progress of leading up to it started before that. but
Yeah.
The adoption of the plan was in 2018.
okay,
Okay.
So there were meetings ahead of that where we actually did the strategic plan
we did
meeting.
the work.
Yes.
We probably did the work in 17
Got it.
then,
Okay.
okay.
Now, I want to, just a caveat, the last sentence of that paragraph is important to myself and staff, because we anticipate revisiting the strategic plan no later than 2022. Anticipates is a very important word here because of resources and time and the ability to meet and those kind of things, and not being able to predict where we will be 8-9 months from now. It's not uncommon for a board, to have a gap of up to a year or two before they revisit their strategic plan again, especially if there's progress still to be made on the existing. But I don't think that's our situation. Our situation is really just about the unknown, not knowing where we'll be then. So anticipates is a very intentional word.
I like it.
So for legislative actions, the next couple sections, these are snippets, if you will, from all of the legislation that occurred through the duration since last sunset. So some of these, if you want to just peruse through them, they are the same materials that you're familiar with from the board meetings. So, and this is the format that was asked in the template itself. And so I will be patiently waiting for you at page 18.
That's where I am.
Okay.
Yeah, 18.
Just to confirm, these are in reverse chronological order from date of statute presentation to legislature? Because I'm seeing effective dates of being effective is being varied, but it looks like they're
Oldest.
based on when
Some of them had a delayed
they
impact,
were introduced, but it's
Right.
based on when they were introduced. Okay.
and some of them had a delayed implementation
Right,
date or
right,
effective date.
right.
Thank you for doing this legwork, Brooke. Is everyone ready to move on to the regulatory actions? Need some time, Dr. Drummer?
Sorry.
That's okay.
Did we skip over major studies conducted by the board?
Yeah, we did, starting at page 18, question number 4. There's 2 sections. One has to do with major studies, and then also any of the national associations to which the board belongs. For question 5, I have an insertion.
Am I the only one who doesn't have that on page 18?
Document page 17 is where number 4 is, describe major studies.
After the red line.
Sorry.
Oh, I'm sorry, I'm doing track changes, so I had a bump.
Oh, I see.
So it'd be 17.
So, well, the regs, there are 5, correct? Okay, and 1, 2, 3, 4, all 5 say the proposed regulatory language is currently in process.
We actually have to make an update to substantial relation.
Yeah, didn't one of them pass, right?
Yeah, so that was one of the things that we were gonna be able to tell you in this section of the Sunset Report, is that one of our regulations has actually made it to being codified and is now law, and that is the AB 2138 regulations pertaining to substantial relationships. That package is now complete, and so we'll make those changes on, within the report as well, and that happened last week.
Okay.
Then I thought you were gonna tell us that the guidelines had been completed.
And it has not
I thought
yet?
I was going to be able to tell you by today that the guidelines have been completed also, so.
And so the way that it's reported out, each reg is reported out here, is that a suggested template or is that what we just decided to do? I mean, it looks good and it's all, you know, a nice snapshot. My question comes from a part of me wanting to add a date of when it was turned in.
Okay. Let me see what we can come up with, and we'll revisit that tomorrow.
Okay.
I'm gonna put it in a notation, because it could be difficult to kind of determine which date it is that you're actually looking for.
Yeah.
Like, when we say turn in versus,
Yeah.
left board control.
Yes,
or, you know,
yes.
that kind of thing, so if I could just reserve that thought and revisit it tomorrow, I'll see what I can come up with.
I agree, because that's something that I would want all board members to be on board with
Yeah,
and
absolutely.
public as well.
Potentially, date, initiated by board. Just, from when we added it to the rulemaking calendar.
Yeah.
Kind of thing.
Adopted language too.
Mm-hmm.
Yeah, I think date of adopted language is probably the most
Yeah.
reliable date. Rulemaking calendar is a little bit different because sometimes, based on resources, it might have been on the calendar, we were anticipating
Right.
and trying to help out OAL or with their workload, and so we said, here are the regulations that we plan on doing, and we didn't get to them that particular year. So, date of adoption will be something that we'll see if we can make up.
Thank you.
And then just so I know that we're on the same page, are we through with regulation and on to question four? So the two major studies? And then any questions about either of those? No questions about the feasibility study for the board's in-house expert consultant?
Mm-mm.
Okay. And then the wellness symposium?
Mm-mm.
Okay. Nope.
Oh, sorry, not a big deal, Jason. I would just, the ending of the wellness section, maybe I would add after issues raised by the CPTA or already addressed, so we just, it's implied, of course, but I don't know if that would add anything. So the very last sentence reads, after careful and thorough review and discussion, the group determined that the issues are are already addressed with current laws and regulations. Just a little modifier, issues raised by the CPTA, or again, it's kind of implied. Just tossed it out, but not married to it.
Mm-hmm. I think it's helpful.
I think it reads well.
Mm-hmm.
I'm not sure if it's in my head as just a word choice,
Mm-hmm.
personal word choice, but issues versus concerns.
Mm-hmm.
Issues carries a stronger meaning for me. that, like, there's a problem versus where does all of this fit? Does this fit into current practice? To me, I guess it's a strength, a power of word issue.
I agree.
I prefer concerns.
Would we then replace issues above at the beginning of that paragraph? Clarify practice issues, or Dr. Grummer, you have an issue with issues, so I'm going to defer to you.
No, I think in that place, there were specific things that the quality practice committee and that licensees were raising. I think that it probably was reduced in power after the symposium.
And we commonly refer to any kind of questions or concerns regarding the Practice Act as practice issues. So I think practice issues is an appropriate use of term.
Okay.
So good with studies, and then on to the list of national associations. The one thing that I did not list here, but
We
Carry
lost,
home.
sorry, we lost our video.
Oh,
Thank you.
we're back.
We're back.
Plan F is at about 80%, and so maybe after the lunch break we'll see what if we can go back to Plan B. We've listed our membership here with the Federation, but I did receive input from the Department of Consumer Affairs of an oversight on my part. Carrie Holmes, Deputy Director of Board and Bureau Relations, did point out to me that we're also a membership of CLEAR. And as board members might remember, the board entered into CLEAR as a member individually outside of the department and provided some training to board members. We did some WebExes with them during this last sunset period. Subsequent to that, the department has now joined CLEAR, and we're able to get a discounted rate, if you will, from CLEAR. So DCA actually joined CLEAR for all of the different boards and bureaus, and in doing that, has alleviated some costs for us as far as that membership. So we will be inserting a paragraph there that speaks to the membership to CLEAR, and we can review that tomorrow. We'll insert that this evening.
Thank you. So we did address voting privileges with the FSBPT. Will we do the same with CLEAR?
Yeah, we already have the language created.
Okay.
I can have that language read to you for just the purpose of incorporating it into the amendment at the end. If you agree with the language, then we can, it's in the comment there, but I believe the comment's just a little too small.
Yes,
I can put it right here too.
I'd appreciate if you read it.
Okay, so the board is a member of the Council on Licensure, Enforcement, and Regulation, CLEAR. CLEAR is an association of individuals, agencies, and organizations that comprise the international community of professional and occupational regulation, providing a forum for improving the quality and understanding of regulation to enhance public protection. And the second one, regarding voting privileges, the board's CLEAR membership is part of a DCA's organizational membership and does come with voting privileges represented by one single organizational vote.
So that's DCA voting? They're the voting member?
Right.
Would we, I'm wondering about the word A before DCAs. does that read better? Okay, thank you for that.
And then we go on into discussing how the board participates with Fsbpt and on committees. We've added a table below that essentially, sorts out each member and how they participated throughout the sunset period with Fsbpt, what committees they served on, what roles they've held, that kind of thing.
Are the tables and charts throughout this document numbered or anything, or they just come in certain sections?
Some are numbered and some are not.
Yeah.
As part of the template. But for kind of the sake of formatting and publication,
Mm-hmm.
we'll go through and make sure that it's kind of uniform before we make the index.
Mm-hmm. Yeah, because, those two, before the chart, the two bullets, ask questions, and the answer is see table below, and the following chart demonstrates. So I looked for a separate table. Dr. Dominguez?
Thank you. Yeah, so my suggestion would be just to move that table, just because it is below our attendance. Put that table right there. It answers the question. Here are the dates. So I just pulled everything up underneath the actual question, how many meetings did board representatives attend, when and where? And then it would just follow. The following chart demonstrates the PTBC board members' participation in Fsbpt activities in the last 4 fiscal years. And then the table just goes right there.
Yes.
But I had the same,
Okay.
see table below, but it's actually, if I remember, it's at least 1 or 2 questions below.
I think the chart moved in edits.
Probably.
Because if you look where it talks about our involvement in the examination, the narrative for that is below the chart.
Yep.
So we'll move that to a much more understandable.
There we go, I think I can.
Yeah, and that's where I put the narrative, Jason. If the board is using the national exam, how is the board involved? And then the PTBC is currently using the national licensure exam.
Yeah.
Yep.
So just to give the members kind of insight into the way that this has worked in the background, this is the first year that we've utilized a live document in a cloud where we can all be in the document at the same time editing and actually kind of see each other who's working in what. And so it had its ups and downs.
Mm-hmm.
I would suggest titling or numbering
Mm-hmm.
and or numbering the tables too. And because then
Mm-hmm.
where you see, where it says see table below, see table 2, board member attendance
Yeah.
at FSBPT or something just to help clarify, clean it up so that there isn't a question about which table I'm going to.
And that's one of the changes that we're going to list out and include as part of that formatting and that final completion. So when you adopt the report as amended, you can consider those things being done with either the executive officer or the board president giving the final say.
When we get it back on the screen, can we go back and look at those last 2 bullets again, please? Because I think it's different on my, going up before the table. Okay, so there it is. How many meetings did the board representatives attend? Yeah. Okay.
And that's where we'll be inserting the table.
Okay. And then that next bullet was about the national exam, how it's developed.
And the narrative for that question is actually below the table.
Mm-hmm. It's good.
But once we move it, it'll be in line.
It looks good.
So, and the table isn't showing committees that people have been involved with. Am I correct with that? Dr. Rubina, and you've been involved with education?
Not
committee?
education, but
But it's Dr.
foreign
Dominguez-
educated.
Foreign educated.
Yeah.
Dr. Dominguez, you've been involved with education committee, correct? Yeah, if those notations could be added, I think that would be helpful. Because that bullet, the first item of that bullet is list committees and workshops that the board participates.
Yeah. Yes, you're right about that. Can I email someone more information?
Yeah, absolutely.
Who should I send that to?
Either myself or Brooke.
Okay, or both. Okay.
So if I'm on the same page as everyone else, I think that concludes section 1.
It is 10 to, well, it's almost 11, and we'll probably break at noon.
We will.
We will break at noon. Does anyone need a break? Yeah, okay. Can we take 10 minutes?
Yes, please.
Okay, let's be back and ready to go at 10 after. That's a little bit more than 10 minutes. Thank you. Okay, we're back on record. It's 11:14, and we were just finishing up with section 1. And board members were to email Ms. Arneson and Mr. Kaiser any other committees or task force that they have served on. And so, all right, Mr. Kaiser, take it away.
So I will expect an email from both you and Dr. Dominguez with your participation on the committees with Fsbpt. I'll also kind of go back through to see, because I think I'm missing somebody, but it might just be my recollection from the previous subset participation, so we'll go through that as well. So we are on into section 2, performance measures and customer satisfaction surveys. I think this will be kind of a quick section in the sense that a lot of the materials that are in this section you've already seen, because we include those materials in our board meetings materials, but we've expanded what we've been asked. So the surveys that this traditionally would have had listed in it were the customer satisfaction surveys that we send out to complainants, of which we get a very kind of infinitesimal response back with. Also a survey that we send out to applicants once they've been licensed, and then the feedback that we get from that. We've expanded it to include the survey data that April Beauchamp collects for our outreach, and we've taken some slivers and pieces from that. And then also Fsbpt conducts a survey at the point of examination. And one of the questions they ask on their survey is how the applicant wants to rate their experience with the application process for the state that they're applying in. And so we've included that data as well. We think it's a fairly good representation, and because it's a prometric, they collect it from everyone who takes the exam. So it's got a really good return rate to it too. So we will start with question 6. You see it says see attachments E and F. We'll give you an example of what those look like. Those are the captures straight from DCA's website. that we've used in the materials that speak to. Actually, I'm confusing two issues, I'm sorry. I'm trying to jump ahead quite a bit. Yeah, so this is one of what the charts look like on DCA's websites regarding performance measures. Has been specifically asked by the legislature to provide it to them in this format. It's the same data that you receive in the board materials, but with our materials, you see in our format. They've taken that data, put it in a format they think is more easily digestible for the public. And essentially what we have to do is just pull it from DCA's website for the whole period of the sunset report, and then include it as an attachment here for the legislature and their staffers to look at.
What performance measures are they referring to?
Both. So the enforcement performance measures that you are familiar with that Elsa reports on during that PM1, PM2, those kind of things all the way through, as well as the new licensing performance measures that Sarah Conley reports at the board meetings. We will print copies of those. They're lengthy because of how long the duration is for sunset, and we'll provide you each copies today.
So they only want us to provide the table. They don't really even ask us to discuss it at all.
In the questions below, they go straight to customer satisfaction. They don't really talk about performance measures after that point. We take the time and opportunity when we can to talk about it in the sections that pertain to licensure and enforcement though. So moving to question 7 for the consumer satisfaction survey.
Yeah, obviously the number of responses is low
Yes.
and not incredibly favorable, of course. Is that problematic?
I don't believe it is. It's, from my own experience, it's typical.
Okay.
We had very similar numbers in our last sunset reporting. We can expect, below 10% almost every time in response rate. And we can expect of those responses, 80% of those are negative in some way, shape, or form. And I think it's kind of common understanding that people tend to fill out surveys when they're dissatisfied and not as commonly when they're satisfied or overly satisfied. So I believe the legislature's familiar with that as well.
Okay, thank you.
I mean, when they see performance measures and the surveys that's reported to them by DCA, it's pretty uniform across the board. We all get kind of the same responses
Okay,
in ratio and also the dissatisfaction in ratio.
that's
I mean,
good to
essentially,
know.
this is somebody that filed a complaint is dissatisfied with the outcome for whatever reason.
Yeah.
So,
It's good to know that that's something that's commonly seen, so it won't be a surprise or anything.
no,
I would call out 6%, 30 out of 506 is 6%. Again, it's kind of implied, but just as a reminder, it's a small return rate here.
Yeah. Very small.
so received 30 responses, 6% to the consumer survey.
Something like that, yeah, I mean, 30 out of 506 is about a 6% response rate.
It's not statistically significant.
2 questions, concerns. The question number 7 talks about customer satisfaction. And then we call it consumer satisfaction, and then the board the table, we call it consumer satisfaction in the narrative, and then also in the table. So I think consistency, because they're calling it customer satisfaction, I would lean more towards changing the word consumer to customer instead. And then because the question doesn't particularly ask for information related to complaint process. But that's what our data is about. That's what our narrative and our data is about. We could potentially have, and I think the question potentially asks, are there any customer surveys customer service surveys that are done. And so I would say that I would try to qualify our narrative with saying this satisfaction surveys are provided to people who are in the complaint process, who are involved with the complaint process, either complainants or respondents. Because I'm assuming respondents are also therapists who are involved with the complaint process may also be involved in this customer satisfaction survey.
They may on occasion, yes.
And so to me, to help to further describe this, I mean, it may be understood by some, but I don't think it really explains this. And so that, because with that understanding, with that explanation, it really helps to clarify, give an understanding about why the response numbers are so low, but then also why the ratings are so low too. Because these are people who are involved in complaint process who are not gonna have generally good feelings about the process that they were involved with in most cases.
So we were semi-conflicted with the difference between customer and consumer and referencing the same way. I think ultimately we decided on differentiating the enforcement related surveys and labeling them consumers as essentially the consumers of physical therapy services. And then as you go on a little bit farther down, we transition into the applicant surveys as well, who we also consider to be customers, right? So like
Right.
all the different types of customer surveys we have, we're providing those.
So through the complaint process though, we're looking at customers of the board, people who the board is serving. And that includes the complainant, the person filing the complaint, but then also includes the therapist or therapist assistant who's involved in the process.
Okay.
So there, I would say customer, because they are consumers of the board's efforts, they're also, to me, I think it goes more towards customer satisfaction about how the process happens. And how did you feel about the service that you were provided during this time?
To ask a related question, Danny will bring up a good point. Do we know of these 30 folks that responded, what the breakdown is between folks that brought the complaint forward versus the respondents, as in the PT or the PTA that ultimately became the respondent in a disciplinary case? Or are they just is 30 just inclusive of both of those? Does that make sense?
It does. So of the 506, those are only those that initiated the complaint, the consumer that initiated the complaint. I don't believe that the respondents are included in these numbers. Carol Phelps, who's an analyst with the enforcement unit, elaborate a little bit more.
Yeah, so all 30, I'm Carol Phelps, I'm an enforcement analyst. All 30 of those surveys that we've received were from consumers. So we'll send a survey card and a survey link out to a consumer when a complaint the process is complete. And that's what that 506 or something was. We sent out that many survey requests and received 30 back, and they were all the consumer side. No respondents.
When you send them out, that you're also sending them to the respondents as well?
We do not send surveys.
Oh,
to respondents,
you don't.
no.
That helps, Carol. Thanks.
Okay.
So if that information could be included, because I think that helps a whole lot with better understanding. And just a question regarding the data that's there. There were 30 responses, but in total answered in each of the years, there's a number that's less than 10.
So their ability in filling out those surveys, they're not required fields. And so some questions are answered and some questions are not.
Okay.
So pretty much everyone skips over some questions.
Yeah, they usually find the one question that they're looking to answer
Mhm.
and provide input there.
So this is not a legal comment by any means, but when I see the title Consumer Satisfaction Survey, I wonder if you want to be more specific there and say something like Complaint Enforcement Satisfaction Survey? Because it does tend to, it tends to, at casual glance, imply a larger group of consumers.
Yeah, I think we can certainly include that as part of the title.
And then I'm wondering, was there any follow-up with the extremely negative commenters, customers, about what was it, what could we do better? For example, 78% of the individuals indicated it was very poor explanation of the process.
So anecdotally, yes and no. The survey results themselves are anonymous, but typically, we correlate some of those responses to phone calls, email correspondence, those kind of things that we've addressed with folks after complaints. So we've closed a complaint, they're not happy with it, and they reach out to the analyst. We take that input into consideration, and we make changes based on some of that input. But there's no way for us to identify which survey goes to which person.
I mean, it just raises a concern to me, the marked uptick in dissatisfaction that happened over the 4 years.
Yeah, and I think you'll see it go consistent, and 33% is kind of typically what we're used to seeing. But absolutely, the only variable that we can identify to those last 2 fiscal years is the global pandemic and COVID. And maybe just a person's willingness to provide feedback at that point.
Daniel, I totally get your point, but we're talking about a small number of folks here, right? When we talk percentages,
Right.
like the 2020, 2021, those a total of nine responses.
And that is one of the problems with the sample rate itself and the participation in the survey back. 9 out of the 506, any anomaly could have, created more negative feedback from one candidate versus another.
Right. And just subjective observation on my part, that it tends to be the extremes of really dissatisfied people who will submit a complaint or will express dissatisfaction with the process, or say that, you know what, the light bulb didn't work.
Yeah.
Versus the other end, where people are like totally happy with, very happy with how things went, and they felt treated really well, and this is the best light bulb I've ever had in my life. And they will, write that comment. So
It's a frustration that I share with staff, because it's one of expectations. So most people with today's expectations expect things to move very quickly. And so even the feedback that we get of someone who is satisfied with the outcome, more often than not, they're not satisfied with the amount of time it took, because they don't have a frame of reference to base their expectation on, right? So there's always going to be, it's taken a year. right? And that's a frustration that I share with staff, even when it comes to communicating, even with the legislature, as an example, because when we set, and we've had this conversation numerous times, where we've set, guidelines that say we have to, we would like to finish a complaint from start to finish in 18 months. Even when we're able to do that 90% of that time, that outlier 10%, those more complex cases, those really egregious, require a lot of investigation, a lot of footwork cases that can skew the statistic by taking 2 to 3 years, but appropriately so, right? Necessarily, as a necessity, having to take that long. It's really hard to explain to people sometimes.
And question 3 in the survey really addresses that. How well did we meet the time frame that we
Yeah.
initially told you? But the other concern is just how clearly were these things explained to you?
Mhm.
How courteous and helpful was staff?
Yep.
Like, if that gets such low ratings, I mean, I'm wondering what it is overall, that's driving that.
There's certainly that potential outcome that the questions are being answered kind of uniformly poor across the board because it's poor. But there's, you can attribute that to a smaller percentage of the response.
Yeah.
And then I think it kind of backs off from there, right? So we can always do a better job, but enforcement staff are pretty service oriented when it comes to complaints.
And I don't in any way believe that staff are being discourteous to helping complainants understand what's going on. But there's something about, that somebody felt the need to check that box.
Oh, yeah.
I'm like, okay, what is that about? What else? Where should we be going? What should we be doing? So, yeah. Okay.
Could I ask a question on that? So, and I agree, Daniel, big assumption on my part is that, in general, their satisfaction probably gonna be influenced by the outcome and whether they thought it was a favorable outcome, what they wanted to have happen or what actually happened. So is it possible in the way that we word the surveys to sort of, in little parentheses, say, regardless of the outcome,
Yes.
how did you think that, the process was explained to you? Was a time frame? So in other words, to sort of get folks to be mindful about, okay, these are sort of independent questions, regardless of the outcome. You may have completely disagreed with the outcome, but beyond that, how was the process? I don't know.
So, I appreciate the idea, because you're certainly trying to temper the expectation, right? You want them to get past the anger and the emotion and actually do a fair assessment and evaluation. This survey language is common throughout the department, so that's, I'll provide this as feedback back up the chain for the department and see what we can do with that.
And just to my prior comment, I think you should also change the name in the red bar at the beginning to complainant satisfaction or complaint enforcement satisfaction, however you wanna. The casual reader, not to name anyone individually, might
Yep.
just look at the chart without reading the context.
Good point. And I think the board is in agreement on the word complainant. Complainant satisfaction report.
Mhm.
And so we've got a little homework to do for the future and then a couple changes to make to the document itself for the complainant satisfaction report. We can move on to the applicant satisfaction survey.
Is it possible to add license in front of applicant? I know, again, it's implied, but we're not talking about applicants for licensure, right? In this section?
We are,
Okay.
which they would be licensed applicants.
Yep.
You want license in front of them?
No, I just thought
Okay.
Yeah,
I thought I'd throw it out there, see
Already
what.
sick?
I
yeah.
think, yeah. Because the board also reviews and accepts applicants for continuing education providers, correct?
We do.
Or not providers, but
Recognize federal
recognize,
agencies.
right. So, yeah, I think licensed applicant satisfaction, yeah.
so you described when the survey goes out for the, complainant satisfaction survey. But here for the licensing satisfaction survey, how does this one go out? How and when?
So you mind helping me with that one?
And by whom?
But we'll also include it in the narrative.
Hello, Sarah Conley, the licensing program. Chair is short. So the applicant surveys go out when the license is issued. So upon licensure, when more applicants receive the survey, you get email with their congratulations, you've been licensed, and the opportunity to provide feedback.
Okay,
But we'll make the language uniform like it is above.
So application process satisfaction survey,
yeah,
because it's going out to new licensees. And that I think should be clarified too, that we're not necessarily, because there are some applicants who are not licensed. And so they don't get the survey.
No.
yeah.
So, yeah, I think just to clarify a little bit, that'll help. And when was Breeze fully implemented?
2016.
So during this timeframe, since last sunset?
It had just been implemented at the last sunset.
Technically, the launch was at the end of the last, but the effects and ramifications of that launch really weren't felt until the beginning of this particular sunset period.
Maybe some statement to that effect, that with the recertification of the Practice Act, or following the most recent recertification of the Practice Act by legislators, Breeze was initiated, or Breeze took effect, or something to that effect, to describe, just because it goes to a whole different process.
Just in general, because the survey results here are for 1920 and 2021, and we had Breeze since 2016, so I'm just trying to get where you're trying to put the context.
To try to just identify that this entire application process during this sunset period, during this time frame, has been we've been using Breeze.
Got it. Thank you.
And the application process, has it changed at all under Breeze during this time? Like from 16 when it started to now? Is it in the same iteration, the same version, or is that application process different?
It's evolved throughout the years.
It's so drastically different, and trying to capture when those changes, it was a constant state of evolution, right?
Okay.
So there was never a static period measurable where it wasn't changing since the implementation of Breeze.
And
All
so-
the way up to within the last 6 months.
Okay, now, current,
Yeah.
yeah.
Okay, because because it's ever evolving and things are changing, that may be part of the reason why there's a drop in some of the satisfaction points from 2 years ago to last year.
Mhm.
Because some changes were made in Breeze that we don't have control of. So it may be good to note that the continually evolving Breeze process, because it's not a reflection of on our application services and what we're doing so much.
I would say it is. So actually Breeze changes slower than we change our processes, because as we identify areas of improvement, we try to update them, but then we can't update the system as fast. And so it's kind of this trying to manage both improving the process, but also using the system we have in place. So I still think that that's a good point, that the process is evolving, but it is based on our actions, not necessarily the system. So, but I can note that.
Okay, thanks. Glad you followed my thought.
On the large screen, are you able to see my comments? On the large screen where it says applicants? Oh, that's Brooke.
That's me.
Okay.
Notes.
Okay, because I put notes similar there.
Oh, that's very good.
Yeah, my
Yeah.
question was
You're
actually.
spying on your computer.
Did you see my comments? No? Oh. Okay, are we good to move on?
I think so.
Okay. That paragraph there where it says applicants, do we conduct workshops? I guess that'd be a question for April and Jason.
I see. Well, I'll just add
Yes.
my comment. Yes, because the presentations have evolved into some of the schools wanting us to actually work with them through the application process. So that's why that was included here, because they, just like the process of processing the applications, our presentations are evolving too.
Yeah, so you're actually walking them through the steps of completing the application?
On Breeze, yeah.
Yeah, during the presentation?
And troubleshooting live.
Fantastic.
Yeah.
Okay, thank you.
Sarah, sorry, quick question. So great stuff. Could that also be inserted to sort of give folks an understanding of what we mean when we say PTBC is working to address this through updating the Breeze applicant-facing portal? So all the things that you're doing, should those be called out? Or are we okay with just, hey, we're updating the portal?
Yeah, no, that was a constant conversation amongst all staff involved, is that trying to define what the changes were, it kind of loses its value based on context and even bias. Like, we understand what those changes mean, but essentially, I think over time, we kind of just watered it down to those changes in the portal, that public-facing portal.
So do you we can work on trying to include some general ideas of what we've done?
No, I actually, the only reason I suggested it is to make sure that we're taking every opportunity to paint a favorable picture here, because you all are working very hard on this.
And I think, this, and just kind of keep this in mind in general, so this is that first report that goes to the legislature, and there will be opportunity for staff and the board even to have communications with the analysts, the BNP committee's analysts assigned to the board who's actually creating the issues paper. It may even come up in the issues paper where we'll actually have an opportunity to talk about that in a little bit more depth, or at the hearing itself even.
For the next sentence after that paragraph, we distributed surveys to new licensees and received 81 responses. Is it worth noting that the survey responses are anonymous? Or does that not matter?
We can.
I'm actually asking for.
It might be a good idea, because for the same reason, like in enforcement, where we can't tie the feedback to the experience.
Mhm.
So we are doing the best we can to respond to the feedback we're getting, but it's anonymous, so we have to look at the whole picture. Or look at trends, I should say.
Encourages candid responses too.
Yeah. That's true. I like the inclusion of sample responses.
So the inclusion of sample responses was a very long conversation. We have a lot of responses to choose from, so we wanted to not, over inundate the report, but also kind of give a fair
Yeah.
representation. So there's lengthy responses here, but we tried to touch on all the different topics that were
Right.
brought up during the responses.
So the FSBPT applicant satisfaction survey actually paints a nice picture, right?
And this one, I think, is a little bit more reliable in the sense that everybody who actually took the MPTE or the California Law Examination at a Prometric Center filled out this survey.
100% response
Right.
rate.
The way that they have the data collection is not similar to ours in the sense they can't skip from one question to the other and that kind of thing. So I think it's a little bit, but again, as it pertains to us, it's just one question on a very lengthy survey that has more to do about the examination process itself. Some questions specific to FSBPT, some questions specific to Prometric and that kind of thing.
I think individuals are a lot more inclined to answer a single question
Yeah.
than three questions.
Well, and that's what I was saying. In this survey, they're only answering a single question about us, but they're answering a number of questions about their experience with Prometric and a number of questions about their experience with FSBPT. FSBPT was kind enough to kind of carve these out for us from the national response rate and sort them by California specific. So this is the folks that sat for the national examination as part of their California application process.
And while there's only one question, it is favorable results.
Yes.
Yeah.
So it's nice to see that it's generally consistent, even though we have a smaller sample rate,
Mhm.
and FSBPT is larger, the feedback is pretty consistent.
Oh my goodness, we're almost done with section 2.
And just one other interesting piece about that is that our survey in 2019-20 had more endorsement respondents than it did exam respondents. 72% to 28%.
Mm.
Last year, it was more exam than
Mhm.
endorsement, 60-40. And there were a lot more responses too. But that with the FSBPT survey, that's all exam, that responses were showed a lot more satisfaction with that.
We just don't know how many of those were in like foreign educated, because they might have just taken,
True.
yeah.
And that's the thing with, multiple pathways to licensure and how you categorize the survey data. It can almost be impossible because they could literally qualify for more than one category, right? You could be foreign trained and out of state endorsement, and vice versa. So, but overall, I think looking at it as just a large group of applicants, the numbers speak for themselves, really.
Mm-hmm.
And I believe actually that this survey is offered for applicants who take the jurisprudence exam,
Yes.
so it would include the endorsement applicants as well.
Yeah.
So it would be,
So this is just for jurisprudence.
it's
It's
for
not
all.
for the MPT.
It's a combination of both.
Either or both.
Okay.
And so you could even have duplication.
Oh, yeah. So if someone took the Cal Law one week and took the MPTA the next, they're
That's
gonna
my
answer it twice. Okay.
Little data mess up.
Quick comment, the title, Education Program Outreach, again, just to be explicit, should we say physical therapy education program outreach? Because that physical therapy sort of encompasses
Yeah, and
PT and
even,
PTA.
and even to kind of take it one step further based on what we did above, you know, where we said license application process satisfaction survey. In the label down here, we could do something, you know, similar to, students and educators program outreach survey, because we do get feedback from both PT and PTA students as well as faculty.
Do you have faculty attend those things?
We try.
I'm being
It
sarcastic.
doesn't go over very well when there's no faculty in the room or on the webcast.
So you might get one or two per presentation?
Yeah, we usually get at least the professor or the instructor for that particular class, but we did have situations where we ended up in a webcast with nothing but students, and the president of the class was very helpful, but there were just things that they could not do with when it came to like share screen, and so we made do with what we had. But
Are there other outreach surveys that we have data for, such as, I don't know, your presentation to Fsbpt or to CPTA? Did we do any surveys
yeah,
after
we
that?
did. I don't know that we have access to them, but I believe there was feedback from maybe 2 or 3 different presentations that we did for the state association.
CPTA, yes, but we don't have access to it.
Hmm. And nothing from FSBPT, the presentation that you did with April?
Just a kudos email.
Mm. Okay.
But not actual survey results.
Yeah. Just wanted to toot your horn a little bit.
For the education program, the physical therapy education program outreach survey, if we have any raw numbers instead of just percentages, I think that might be really helpful, because it will show that 3,000 students, or whatever the number is, were participated or something like that. And then we show that 97% of them. I mean, that gives you a much better reflection of the power of it.
I agree. It doesn't have to be too detailed, but I think the visual glance would be really nice. Yeah.
Yeah, including the raw numbers is just to our benefit anyway.
Mm-hmm. Any other public comment? Okay. So it's 11:55. I think it's a good time to break. Any expected time to come back?
So lunch will start at 12:30.
Oh, it starts at 12:30.
It's been delayed a little bit.
Oh,
The delivery has been delayed a little bit.
okay.
But we
They
do
couldn't
have,
connect to the network.
they had internet problems as well. But we do have a few fill-in kind of things in the background that can be done until lunch.
You mean here, board business?
Board business, but off-camera business, yes.
Off-camera business. Would you like to do that, or would you like to keep going?
I'd like to do that. I'd like to continue to break at noon.
Okay.
take care of some housekeeping stuff and then go into lunch as soon as the food is available.
Okay.
I would imagine returning, well, so a question for Madam President is, when would you like to take on closed session?
End of the day.
Okay, so we can return back at 2 o'clock?
Is 1:30 pushing it?
1:30 is doable.
That would be 1 hour for lunch.
Yep.
Yeah.
Perfect.
Yeah. Okay, so we will adjourn. It's 11:57 and we'll expect to be back on record at 1:30. Yeah? Thank you. Hi, we are back from recess. It is 1:36 and we are ready to proceed with section 3 of the Sunset Review Draft. Mr. Kaiser.
So picking up where we left off, now on to fiscal and staff. We followed the template, and this particular part of the Sunset Report has not changed too much over time, with the exception of just updating the time, the frame of time. So there's some language in here that is redundant from the last time around when things have not changed, but there are also updates. So starting with question 8. Because we are a special, very similar to the question last year, because we're a special fund, because we are not part of, but very accurately and projected.
Is that each of the past 4 years? Or is it 4 years in
Yes.
total?
Every year after year.
So I would suggest just breaking that out. So over each of the past 4 years, the PTBC has had budget over expenditures in personnel services. Something to, because I mean, something to say that we're going, how we're overexpending, like that it's.
Okay. Question 10.
The final paragraph, PTBC may need to pursue a fee increase. I would suggest will need to pursue a fee increase based on its projected decrease of the fund. Because that's really where we're at. It's May is like, yeah, we might need to, we might
Sure.
not. Like, no, we will need to do this.
It's inevitable.
Yeah, which then I think helps to support the ask that's coming.
For the caps.
Yeah.
Yeah, and as you can see, just in the fund condition table,
Yes.
you know, with that last fee increase, we were able to address the problems that we had. It's just the economy and cost of living has caught up with us a little bit. Plus, we moved into a larger space, we've employed new staff, and with that comes a greater expenditure. But this is the first fiscal year where you really start to see we're living a little bit beyond our means at this point. And so as we move from year to year, you'll see that start to creep down a little bit. And we've discussed this in the past, there are things that also affect that aren't covered in the projections, right? Because we use our current revenues as a flat line, it doesn't account for things like a growth in the licensing population or an increase in the applications received. they will have an effect, but we can't guarantee those effects, right? I can't tell you that 3 years from now, we're gonna have such and such much of an increase in the applications, so we don't do that in projections. It'll be foolhardy and irresponsible. And I think moving in the projections that we were looking at outside of what's asked in the sunset, I think we start to look at our previous situation of, getting close to insolvency fiscal year 24-25 without a fee increase. So it does become urgent at that point.
Is there a chart on the fund up until 24-25? Is that charted somewhere in a table?
Not within the report, because in the tables in the report, they're asking for that specific period of time. But we watch out that far.
Yeah.
Maybe that statement can be added to the narrative. There it is. Yeah. It is. Because you do
We talk about when we get close.
that last paragraph. Okay.
I'm just wondering if they're gonna wanna see that. Are they gonna wanna see the continuum of how it goes from, 7.3 in 22-23 to 1.9 in 24-25?
I think as long as we're able to kind of demonstrate the beginning of a downtrend,
Yes.
which I think this does, right? We were at 10 and then it goes to 8 and now we're down to 7. They're very used to seeing these numbers, and that's a concern, right? And at the same time, when does a fee increase become a necessity?
Yes.
And typically you find out anytime you get under 3 months in reserve is when you want to start looking to, contemplating a fee increase. And so I think for the purposes of the report, we're there. Visually, I think there's so much in that chart that even squeezing another fiscal year in there would be difficult.
Yep. As long as it's not necessary to make the case, as long as there isn't anyone on the
Yeah.
committee who's gonna push back against it.
I believe the argument is compelling the way it stands.
Okay.
And to a certain extent, the Sunset Committee is more interested in that period of time than the future.
Perfect.
And so are you all in question 12 at this point?
I am.
Okay.
And any public comment, please feel free to come on up, raise your hand.
Again, these are some of the same language that you see in our board materials, so they're pretty familiar. And is that page 29 for you?
29 and 30.
29 and 30. Any questions on the text until we get to table 3?
None from me.
Okay. Starting with table 3, expenditures by program component. Again, very familiar with the information that you're provided from quarter to quarter.
Mm-hmm.
Then we move into question 13, which is kind of the still hot button topic with the legislature about Breeze. And we had, the committee was very helpful with us in crafting some of this language with the questions that were asked, because, the BMP committee is very interested in the expenditures created by Breeze, and is there ever going to be a time where we're not contributing or spending on Breeze? And really the simple answer to that is no. Breeze will always require some IT maintenance when it comes to server and programming, and any kind of statutory or regulatory change. The system has to be flexible enough and has to be staffed with technicians that can accommodate this. And so you'll see in the current fiscal year, that $177,000 cost. The easiest way for me to explain it is essentially it attributes to one analyst at state pay that's assigned to this board, right? So we're essentially contributing to one tech analyst to help with anything that's Breeze related. We have access to the rest of the resources, but that just happens to be in proportion to our allocation.
A lot of money.
If you think about the licensing of a software product, not really, right? When you're talking about entities and especially with the changes that we ask to make in programming and that kind of thing, a small business could spend, close to $100,000 on a point of sale system. And essentially that's the way we have to look at it is Breeze is our input-output system between us and our stakeholder.
Do they have a breakdown of cost per licensee or regulated individual who's a participant in Breeze?
So the breakdown is more about per transaction for board, right? How many transactions does a board do within the system is where you'll see this 177 come from. So the higher the transaction mark, the more you contribute to the cost of the system.
And it would be interesting to know, does the Board of Cosmetology, who licenses far more individuals than we do, what the cost ends up breaking down to per individual?
That's an interesting concept I haven't really put. So I would tell you that their costs are higher, but divisible amongst their population, I'll have to look at it.
Yeah, and because they have more individuals, I would expect their cost to be higher.
Right,
But
per.
Does it break out close to where it should be per individual, or is it a case where the smaller boards are actually end up contributing a lot more per
So
overall?
anecdotally, I'll tell you that some of the smaller boards benefit from the higher boards or the larger boards' costs. So, and I think the DCA and the calculations in pro rata account for some of that, but at the same time, your query about, as an example with Barbara Cosmo and the cost per practitioner and how that kind of weighs out, there's a lot that could be that could affect that math, right? And so, as an example, when I say per transactions, a lot of that has to do with the architecture of design. In your system, how many transactions did you feel was necessary to put in?
Right.
We tried to make things simpler and eliminate transactions where, just from my experience on the change control board for DCA, some boards have a tendency to complicate the process by adding additional transactions in, almost like a step-by-step process. And does that increase their cost? I don't think there's a direct, but there's absolutely a cost increase. I don't know that you can put a direct dollar per transaction cost to it, but I think that would affect the idea that you're thinking of, where like Barbara Cosmo as an example, if they have a 5 or 6 transaction process compared to our 1 or 2 transaction process, there might be an effect there in the divisible.
Yeah.
Well, that number is going down.
Yeah. Well, and so if you look at like fiscal year 16 and then 17, a lot of development was still occurring.
That's
Even though we went live,
Yeah.
we were still making some significant changes. We still had the vendor on site and access to those resources. And when we had the access to those resources, we paid for them. About 1920, the vendor contract expired. There was a transfer of knowledge from the vendor to DCA IT staff, and now they start to handle some of those same changes that the vendor was handling previously. So the costs are down to where I expected them to be now. It's not to say that they may not go down a little bit more later, because they potentially could, but I always expected about $150,000 a year. The next question is just a description of the last fee increase in narrative, what we did to each particular fee. And then we also put it in the table form. And the table does come from the template.
And that'll get formatted to fit the page.
Yes. Formatted, also style, color tone, that kind of thing also. For question 15, we talk about the budget change proposals that we presented each fiscal year going back to 2018-19. And those are almost always staffing for us. And a brief explanation to each BCP. When we get down to number 16, for those members that participated in the last sunset, you know, we used the word staffing deficiencies just about anywhere and everywhere in the report that we possibly could. And here I think we were able to, you know, we've solved a lot of those problems, so we were able to localize it a little bit better. We still have a few vacancies left, and as the narrative kind of points out, we plan on filling those vacancies before the conclusion of 2022. As we move to the next, it's that more familiar item of the exempt level change for the executive officer's position that we also have agendized for the meeting to discuss tomorrow. And this is just an introduction to that conversation. Further down in the report in section 12, we go into it a little bit in more greater detail, similar to the materials that are in the package. And as you see at the conclusion of that introduction, there is a indicator to go down to section 12 for more information.
Mm-hmm.
Number 17, talking about our efforts to train and provide training to both staff and board members. One of the things that we decided was, you know, along with our acronyms page, we wanted to make this as easy for Joe Citizen to read. And so one of the things that came up during the subcommittee's conversations is really what does pro rata costs mean when it comes to the Department of Consumer Affairs. And so we've defined it, if you will, a little bit using some of the information that we were provided from DCA. One of the things that I think is just a highlight for members to know is that during the global pandemic, one of the things that we did kind of emphasize on for staff is their ability to access training online. And so while they were working remotely from home, setting an expectation of a certain number of courses per month so that we could report back compliance to the Department of Consumer Affairs. I am at the end of that paragraph right before the next break into the licensing program. Are there any comments, additions, concerns, or anything that we need for fiscal and staff?
None from me.
And then just as a point of like formatting, licensing program will actually start anew on a new page, right? They'll have their own sections. So in this section, we start off with the performance targets and expectations. And this is a little bit, it's similar to the conversation that we have about the Consumer Protection Services Unit, the PM 1s through 7s. It's a little bit different for licensing performance because we have different pathways to licensure when it comes for PTs and PTs and CAPT or foreign trained or equivalency trained. So performance measures are a little bit more difficult to come up with a good performance measure that actually applies to all the different ways or paths to licensure.
So when I look at this section, there's a lot of information, but it's hard to find the answer to the questions. So what are the board's performance targets and expectations for its licensing program? It's a little difficult to find the answer to that in the narrative.
And that's what it's a little difficult to answer in a single sentence too. So, dependent upon the person, they could have a certain number of variables that actually change their target. The difference between foreign trained or CAPT, or foreign trained but endorsement with work experience, or applying by equivalency, or something like that. So we do have some general targets, but they're more about targets of time based on where that person is in the application process. So if they have a complete application, meaning no deficiencies, they've taken both exams, they've passed both exams, their fingerprints results are back, so on and so forth, then the target would be to issue that license within 90 days. We know that with the way these targets are going to be reanalyzed, if you will, especially with the use of Breeze and some of the changes that we made to Breeze. With some of those things, 90 days is more like 9 days. So once the application is totally complete and we've met all the deficiencies, we'll have to do that. But these are the targets that were set at the inception of the launch of Breeze.
So when you talk about a target processing time for complete application, what's the beginning and end?
Yeah, it's hard to catch in the way that the performance measures were made at the time.
So I'm thinking, and I could be thinking wrong, that a target processing time, if you have everything complete, everything's in, there's no deficiencies. I mean, if that target time is 90, that's great, but I know we're doing much better than that, So can we just say, these are our targets and they're being met, or add another column that says what we're actually doing so that it explains it?
We kind of have here. So in the second graph, we talk about actual numbers. But just to your point, the other part of the conversation that is not easy to make understandable is that no one actually comes to the application process with a completed application. All applications, at least for the Physical Therapy Board, because of the way the system is set with fixed date testing and a jurisprudence exam, and even a clinical for foreign trained, that affects our ability to use the words completed application, right? So everybody comes to our board with a deficient application.
That statement needs to be made very early in the narrative, because that will set the tone for the rest of the explanation. That statement needs to be very, if not the first statement, it needs to be very close to the first statement. So that
Sarah's coming up to join us.
So then it will help to clarify all of what follows.
If you don't mind, I'll join the conversation.
Please do.
Okay, so there's a couple things that affect explaining the our performance measure targets, and part of the discussion is a complete application versus incomplete. And we just recently talked about updating processes, updated the process so that applicants can actually come to the board with a complete application. They can actually take their exam before they submit their application. So while it's new, a newer concept, we actually could receive an application that's complete. So that is actually, it's possible. It's just not as frequent as it could be. It may be in the future. The other part of this is explaining the difference between, for most boards, they measure their performance by transaction. Kind of like Jason was talking about how Breeze, they account for how many transactions are processed. Everything's by a transaction. We are changing, we just recently done a recent change to a new transaction that's a single transaction for the whole application process. It used to be two. And if you applied for your exam, that's one. You applied for your license, that's your second transaction. Now we have one because our process has always been one. And what we want to do is track the time, the processing time from the time the application is received to our board to the time the license is issued or a decision is made, whether it's a license is issued or denied. And tracking the transaction time for us, for our process, didn't capture that whole processing time. So while we do have our performance measures that were tracking the transaction process, it wasn't giving us a true picture of our total application processing time, which is what we're trying to present here. And so, like we would say, for example, a new CAPD graduate, our goal is 90 days. And so that goal would include receiving the application, acknowledging it, doing an initial review of everything. And the reason it's 90 days is because there's a lot of system input of information and verifying records and all those things that have to be done. Because otherwise it could be faster. And in some cases it is, but it also depends on the time of year, the volume of applications. There's a lot of variables that go into this. So we try to consider that in establishing our targets. So we did present the targets for each application for that total time, beginning to end. But as we were trying to explain the narrative, it's different from the performance measures that are going to be in the attachment, which is by the transaction. So does that make sense to everyone? So when we're talking about total processing time, that's different than our performance measures that are going to be attached, that DCA reports.
Why are we attaching those?
Because that's the data that they've asked for, and that's what we have, even though it's not really how we track our process. That's what we're trying to explain, that difference.
It's for me, it's confusing.
I know.
It's very confusing. I feel like if I don't know, Sarah, I know this has got to be difficult because you know all of the nuances, but if there's a way to just answer the question,
Okay.
I know there's a lot of moving parts and if, ands, or buts. I don't know, maybe another member can help me out.
And we
Am
can
I the
do
only
that.
one?
So we can just report our processing times. It's just not going to reflect our business process.
Yeah.
And so, but that might be saved for the next sunset.
I'm just thinking, and not for me, I'm thinking of, the joint committee reading this and consumers reading this
Mhm.
and being able to just get the snapshot that they want and the information that they want. But I don't know, I need help from other board members. Am I thinking solo here? Am I the only one confused?
It's challenging to tease out exactly where things are. Yeah, like you said, Alicia. Like the question is, what are the targets? And then there's long, complicated narrative about all of this other stuff that I think, even if we did the statement like I just said to Jason, that virtually all applications that are initiated are incomplete.
Mm-hmm.
This prevents us from being able to establish a firm target date for all applications.
Mm-hmm.
And with what you just said, that there are some that are complete. If you just added, like in the middle of the paragraph, The performance measures include initial application volume processing time for number 1, complete applications, and number 2, incomplete applications. Even if you left that sentence there and you just said for complete, you just put a percentage of how many are complete. Off the top of your head, how many are complete out of total?
I can't, I don't, I'm,
1%, 10%?
yeah, well,
I mean,
that's hard for me to say, again, because it's by the transaction, so,
right.
Most of them are incomplete.
Okay. So if there was, I mean, and I'm gathering that from what Jason said. He said all. So I'm guessing that the number of complete applications that you get in one transaction are right there. I have my complete application. How long is this going to take? I'm guessing that number is really small. Versus all of these are incomplete because they haven't taken their exam. They have all of the processes that are in place. So it's not clear enough to me to say the majority of these are incomplete, just by the nature of how things are processed with us at this point. And maybe say that this is we're expecting this to change with modifications, future modifications coming to the process. That may help that a little bit better, but yeah, I think if we can somehow, because part of the reason that we're not meeting target is because of the incomplete applications, the number of incomplete applications that we have that are in process.
And what we can do too, kind of on the same lines, is just report what we have and say, we're not meeting our transaction targets because our business process doesn't match that data collection method, which is the bottom line.
Yeah.
Our business, we don't use the transactions in a way that would capture that processing time.
Yeah.
And our process is a 2-stage process, or can be a 2-stage process, and is utilized that way for the majority of our applicants. If it's the application for the exam and then the application for licensure that follows, because if I'm picking those correct.
Yeah, that's
items.
how the system captures it, but it's not how that process works for us. So if you'll see, if you look at the attachment, for example, we'll have a processing time of our initial transaction will be, let's just say it meets the target, so 90 days. And the second transaction will be 1 day, because you're literally going from, you're just bypassing it to issue the license.
Right.
So that's the kind of data that's going to be seen in the report, just so you're aware.
Yeah, I think the first table is actually captured in the second table. Right? So the first table is redundant because the second table includes that, right? And so on the headers there in that second table, you got your license type, method, complete/deficient, and target. I think it would be helpful to have under target in parentheses like days.
Okay.
Number of days. And then you've got your data for each fiscal year after that. And we can see in the far right-hand column, at least for US exam, that we're within that 90 days, right? We're actually improving. And so that's really good. As a matter of fact, yeah, that looks good. I mean, this table gives everyone the data and tells the story. And then so this is answering the second part to the question, how are you doing? And if not, what can you do to improve? But I also feel like in the narrative, maybe you can say that once it's complete, the license is issued. So, there's all of these steps in between, and it depends on what kind of licensure it is. But bottom line is, when we get everything we need, we issue within, you've given that to us in the past in board meetings. You've given us that information where it's like 2 days, 3 days, haven't you? Or am I thinking of something else?
And that's dependent upon the application and where it's at. So in some cases, we can issue the license immediately after the exam, like 1 day, because it's automatically set up. In some cases, it can be 14 days because if it needs manual intervention. So even that is dependent upon. That's why we were trying to look. So I want to make sure that we're clear on the data that's being presented.
Yes.
The chart that you were looking at, that is not by transaction. That is the whole application process from beginning to end.
Yes.
The the reports I was talking about that we're going to be comparing to are by transaction, and that would be the attachment.
Yes.
And so I can go back and match up what's being reported in the report with the performance measures that DCA reports, but it will not be that whole processing time from beginning to end. It will be by our transaction, and that's back to not reflecting our business process. So I just want to make sure that that is clear, that if I change it to match what the performance measures are that DCA has, it will not be the information that's in this chart.
Mm-hmm. Well, I mean, I feel like if you wanted to leave the chart as is, I would be okay with that, as long as we just more clearly answer the questions above.
Okay.
But at the same time, what is the board doing to improve performance? I'm sorry, I don't know if it's underneath in narrative, but there are many things that your unit has done to improve times. You've designated certain people to certain types of applications and increased efficiencies there. I don't know if we have data for that, but you could at least, is it in here?
So that we were trying to break up, so questions 18 and 19 have similar,
Okay.
it's kind of similar
Yes.
questions. And so we broke up their responses by kind of the positive impacts on question 18, and then things that are negatively impacting the process in 19. Like what are the increases or decreases in the board's average processing time? So the question 19 has some more information. So it's kind of spread across the two questions. It sounds like the biggest concern is with the beginning paragraph. So I can change that to just be more direct and just say, provide our established processing times. So is that introduction of all of that background information, is that not, is that too much information?
I'm going to let another board member answer.
Just before we go on to the next question, I want to make sure that we're comfortable with question 18.
Sorry, Sarah. I think when Tanya and I were meeting, I think we also had some questions on this particular section. And in my mind, it's really all about, when do you start the clock? When does the clock start to determine whether or not you're falling within those 90 days? And I'm sure I missed this before, but is there a reason why it couldn't be a two-step process? It seems like once an application is complete, the process is a bit smoother. It's just sort of this submitting an application that's determined to be, deficient or incomplete. That sort of hangs things up. Or am I misinterpreting that?
So when we have an application, when we receive an application, we review it for everything. So I'm trying to think our process is you apply for a license, period. It's one process for everything. Exam eligibility is completely separate, but that's not how the system is tracking our performance. And so that's where I think that difference, it was where we're getting hung up. So I don't know if that is helpful. So the numbers that are reported in this chart are from beginning to end. Like you were saying, where's the clock start and where does it end? I think where the discrepancy is that it doesn't match what DCA is recording from the system.
And I think that's where just the breakout statement needs to be made, that because of the multi-step process, the two-step process from initial application to completed is part of, it helps to explain why we're not at target as much as we want to be. Why things are not as fast as they potentially could be, because applications are not complete, because exams haven't been taken yet. Yeah. So-
Sarah, you're so good at what you do that you are like in there and you know why. You know why things are going the way that they're going. But maybe just for the sake of answering this question, draw back to that 30,000, view there, and just see if you can take a stab at leaving your targets where they are, and just seeing if you can simply answer the question. And if you feel like you need to add a little bit in of what you have for explanation, that's fine too. But we could take a look at it again tomorrow and see, or whenever, and see what you come up with. I kind of felt the same about question 19. I made a note here that says the first sentence should get to the heart of the matter. Are there increases or decreases in the average time? So you want to make sure that you're giving them what they're asking for. That's what I'm thinking anyway. Because this question as well, I felt like I didn't quite get to the heart of the matter. And then my comment toward the bottom of 19 is that, and you just said it, you was like, we kind of did one where you're like emphasizing the positive and one where we're kind of emphasizing the negative. I made a comment, this makes it seem like we're doing a poor job or we're not hitting our targets, but aren't we doing a good job? That's what I wrote in my comments.
I think that made me think of something. I think that's part of our dilemma is that we are in our performance, but we don't have the data to support that really with our performance measures the way it's collected with the transactions. That's why we wanted to present it in a different format, which is the from beginning to end format.
Yeah.
Because it is more reflective of the work that we're doing. So I just want to make sure that, so how are you feeling about the table that's in with all of the, because that they do ask for that. So what's your cycle times? So I would leave the table in with the number of applications and the cycle time that's there. But it sounds like I need to simplify the narrative. Is that generally what I'm hearing?
My assumption is that the table is part of the template.
Yes.
So the table has to be the table. Potentially an editor to just in the wording of the table, just to help it be clear that you're talking about days or like Alicia had suggested, just something to help make that a little bit, it just makes it easier to look at it and go, oh, okay, that's what they're talking about.
Okay.
Because if I just see numbers and like it, like, okay, what's that? What is the number about? Yeah. So that helps me. And then, then in the narrative, because we don't track information the same way that they're asking for information to be tracked, that we just provide a clarifying statement about why these numbers are different, not what you, the legislator, is going to be expect to see.
Okay.
So try to put it's hard, think like a legislator. I say that, but I don't want to say that. But if you're like, okay, how's the legislator gonna see this and take this in? Like, I think that they would read it and they're like, oh, wait a minute, you're way off target. What's going on? But if you put yourself into that mode, then you can write it. It helps me. I know it helps me to write the right way, or write in a way that somebody else reading my progress notes for my patients will understand. I can write in PT speak all day long, but only other PTs are going to really know what it says. But if I write it in a way that somebody else is going to be able to understand what it says, then it helps them. They don't have to ask me 1,000 questions, and it just makes it cleaner. So,
okay.
Like volume, that's number of applications, right?
Yes.
Okay. And then again, like maybe whether it's in 18 or 19, like what are you doing to address it? Well, gosh, you guys have done so much. You guys are really doing a good job, and you're making changes to address these things. So somehow toot that horn that you're making these changes and you're seeing the difference, because we're proud of that. We're proud of what you guys are doing. Let's show that off.
Thank you. I appreciate that.
Yeah.
So I was trying to think about how to present. It's in that same kind of perspective, like how do we include that information that is simplified enough to digest.
Yeah.
'Cause some of it's not, not easy to convey,
Yeah.
but we'll work on adding that. Okay. And it sounds like because the targets are already included with the processing time, that they don't, it sounds like the suggestion is to remove the target chart that displays the different targets we have.
I would be in favor of that, but I'm also open to how you feel or how other board members feel or staff feels.
Staff actually had a conversation about that prior to this meeting, and we were, I think it's our opinion to remove it, but we left it for the benefit of the board to see and make that decision.
Yeah.
It's redundant to the chart below it, essentially.
Yes.
That's that's what was being discussed.
So I'm for removing it. How do the board members feel about that? Removing the first table with the target date since it's already embedded in the second table.
Are you asking for a straw poll?
Yeah. Yeah. Dr. Drummer?
Indifferent.
Okay. Ms. McMillian?
Remove.
Dr. Dominguez?
I would say remove. The only benefit to that table is, I think Daniel probably brought this point up, or maybe it was you, Alicia. It's just, it is a table of numbers with no, I mean, you can deduce that target probably means days, volume probably means number of applications, but it's not explicit in that chart. So I don't know if we can mess with, probably
Yeah,
this is the
we
template
can-
we have,
We
right?
can certainly provide better definitions at the top of each column.
Otherwise, it's just a sea of numbers with some descriptors. So we're mixing days with number of applications and maybe not as clearly stated. But besides that, I'm neutral. Sure, we can remove it. The first table?
The first table, right?
Yes,
Okay.
yes.
And then clarify all the information, the data that's provided below.
Thank you, Sarah.
One of the things that I'll just point it out for almost all the categories, as we move through the fiscal years, the numbers go down, regardless of whether the volume goes up or goes down, the number of days and the cycle time goes down until you get to foreign.
Yeah.
And that's kind of an anomaly that it's more dependent upon what applications are received. So
And that's why it is more complicated to get into this detail of the type of application, like the qualification method. But I think it's important to make those distinctions, especially like, for example, the foreign. Why does it take 3 years? It's a completely different process. So if we grouped all the applications together, it doesn't tell a true story of what's happening.
Yeah, I agree. And renewals are beautiful.
Now those are more straightforward.
Yeah. Okay, any other discussion on numbers 18 or 19?
I just want to make sure I understand. So you wanted to see more of both positive and negative in 18? So just rework those two questions some more.
Yeah.
Because you saw what was done positive in 18 and kind of the impact.
I agree with you
19.
that they ask very similar things. So it's kind of hard to, I guess you can just answer the questions in 18. And when you get to 19, you can refer back. That's the best advice I have, because how do you split between the two when they're asking pretty much the same?
So we can definitely work on that, but that was our struggle.
Yeah. Let's see. First.
No, I don't know that they're the same.
You think they're different?
I think they're different. 18 is, what are your targets? Are you meeting those targets? If not, what are you doing?
Mm-hmm.
And then 19 is, let me get to it. Things haven't gone the way that you thought they were. Why not? And what are you doing? So I think there's a subtle enough difference.
Okay.
So I will bring this back to you tomorrow.
Yeah, you know what might be helpful, Sarah, is if you take the questions and just write one simple thing out to each question. You know what I mean? And
We
then
do.
that's
And
okay.
then we sew it back together. We actually did that with committee at times too, that to just make sure that we covered everything that's accounted for in a question. There are some questions though, that in some questions are intended as they're asked in a more general fashion that may apply to a different board or bureau that don't necessarily apply to us. And those make it difficult to do that with.
Yeah.
And we did struggle at times going, we have to put something there.
Yeah.
And then it was like, well, no, you really don't.
Right.
Yeah.
Right.
Sew it back into where it was and
Yeah.
be done with it.
Yeah. Less is more.
Mm-hmm.
There's a lot of times when less is more.
Yeah. Okay. Number 20.
The next part's denials, but I'll just stay up here for the section if that's okay.
I'll let you drive, Jason.
Okay, so again, this is another area where the committee was very helpful. And Elsa Ibarra, the board's assistant executive officer, in helping to try and formulate kind of an answer to this question. This kind of goes back to the 2138 regulations and denials of applications. And so we have the numbers here of the licensing population. The table does seem a little bit out of place, but that is where it is in sequence. You know, it's just as they ask question 20 there, I think that's their attempt at putting it into context by including that table. And then if you go below the table, we start to get into the narrative of where we were with not just denials, but where our PTs are located in state, out of state, and out of country. And, you know, as you can see for the fiscal years, we don't deny licenses very often. Obviously, they're case specific, and the numbers could vary from one year to another without any kind of explanation, just because they are case specific. But considering the number of applications that we receive, even, you know, 8 applications being denied in 17-18 compared to the license or the applications that were received, that number's infinitesimal. It's almost not measurable. A little bit further down, for that fiscal year, you'll see a case-by-case description of those 8 cases and how those situations worked out. So for that top criminal conviction denials, we've changed this table a little bit to tell a little bit more of the story. Originally, it was a 2-column table. And so we've added columns at suggestion of staff and both the committee to also talk about what was appealed and then what went on then to be licensed in a conditional license. So fiscal year 17-18, 8 were denied. 7 of those 8 were appealed. And of those 7, 5 were issued an initial probationary license. So only 3 actual denials for fiscal year 17-18. Outright denials is probably the better way to say it.
Would you add another column that said that then? Potentially?
So you highlight it even further?
Yeah.
Not a bad idea.
So Jason, the template actually included table 6 right where it is here under number 20?
I believe so.
Well, if that's the way they want it.
I think we've moved it once already, if I remember correctly.
It seems like I mean, I don't know why it's there, but the heart of the matter is, below that. All the information you've provided.
It's
So-
about the licensing, the population.
Mhm.
Yeah, it was there. We tried to find a new home for it, but it didn't really fit anywhere. And so it went back to where it had started.
Okay.
And like I said, I think it's a context table, right? So looking at that first, it gives you a little bit insight into the further tables below it. How many licenses does the board even have?
Yeah.
How many are active? How many are out of state? How many are out of country? Retired status, so on.
Okay.
Is there a good understanding of what delinquent / expired means overall?
And whose understanding?
Anybody who's going to read this table, because I still don't have a great understanding of what delinquent and expired relates to, because it's not retired, and it's. I mean, I'm more. It's a license that we're still paying attention to because it's still out there.
It's a renewable license, in the sense that at any time they can come back for that 5-year period of time, just by paying a fee and answering a questionnaire. That number is probably one of the numbers that fluctuates the most from any one day to the next because of just the activity of renewals, people coming in and out of that status. For the BMP committee, I think they're very familiar with expired and delinquent in a sense that, how many of your licensees went through the trouble of getting licensed and then for whatever reason are not actually active in your state, whether that's a loss to another state or a loss to them to a different profession or not to a profession at all. How many are sitting in your books just waiting to be renewed but haven't? And that's why I said that number is, you have to be a little cautious with. It's only worth what it's worth because it can change from one day to the next.
Right. Okay.
In this section, this table, I had to go all the way back to the beginning, acronyms, to find out what SOI is.
That's good though, because if we didn't have the acronym table, you wouldn't have found it.
Is that a common acronym?
Common from amongst the boards, yeah.
Okay.
I mean, any board or bureau involving the disciplinary process is going to have a statement of issues.
Okay.
So before I leave the topic really quick, that criminal convictions, denials, and adding a fourth column that actually says something to the effect of ultimately denied.
The question that I have is what is the legislature looking for when they ask for denies? Initial or ultimate? Right, so Daniel's fourth column gives them the ultimate, but I think it paints a nice picture that we give them, look, 8 were initially denied, 7 were appealed, 5 were ultimately issued probation, so the balance is 3.
3 denied.
Didn't get it. 1 apparently didn't appeal, the other 2 appealed, and it was denied. I think.
So I like your use of the word initially denied
Yes, I do too.
for that column, and then just keeping denied for the fourth column.
Take out the word total and make
Right.
it initially denied. Yeah.
I think that paints a picture to anybody that might read it.
Can I ask a question
Mm-hmm.
on the licensing population? I'm just wondering, and it's just curiosity mostly, but is there a reason why out of state and out of country, the numbers for those aren't listed? I see them listed below in total, but I'm just wondering why they aren't listed by year.
Yeah, the simple explanation is that the numbers that you receive in total right now are capturing time today, but we don't have the ability to capture them in time for each individual fiscal year. if we had run the same report today and we had the opportunity to have ran it in 17, 18, we could have captured that number, but it wasn't available.
And that category must be included because this is their template.
Correct. And from our research, you'll find it's very common for that category and that column to be blank.
Okay, thank you. Everybody good? Ready to move on to 21?
This question has slightly changed from the previous template to this last template. Again, I think that it's driven by some of the same concerns that AB 2138 was drafted from. When we would ask an applicant about their criminal history, we would look at the answer to that question and apply discretion regardless of whether they answered yes or no, right? So we would ask, do you have criminal history? And they would say yes, and we would apply discretion. They would answer the question no, but we would also receive fingerprint responses from the Department of Justice that indicates that they indeed do have criminal history. At that point, we would ask the applicant for an explanation of why there's why there's a difference between their answer and what we actually have proof of, and we would still apply discretion. There was a concern regarding another regulatory board where if the applicant answered no to the criminal conviction question, but the board received criminal history on the fingerprints, the board would just then deny that license outright. Again, we didn't do it that way. We would ask the applicant. The applicant could have a very reasonable explanation, something along the lines that their case was dismissed in court, or their attorney advised them that it was not going to show up in a screening or something like that, that they weren't necessarily intending to defraud the board in any way or be deceitful. So that's the purpose of the question. And so you see with ours, we provide the explanation, and then we say, in the past 4 years, we've denied 3 applications for licensure in part for failure to disclose, and almost always in part. We've never actually just denied based on their failure to disclose. It just happened in these 3 cases to be part of that denial. And I think it's important for us to be clear with that, because that's the intent of the question from the legislature is, did you just deny a large portion of applicants because they made a mistake on an application?
I think it's clear. It's good.
Next question, does the board fingerprint all applicants? And based on BPC section 144 and an explanation of what kind of fingerprinting that they're subject to. One of the things that we've pointed out is that we don't receive what we call rat back or subsequent arrest notifications from the FBI. We only receive them from the Department of Justice. That's planting the seed for an idea at some point, should the legislature want the Department of Consumer Affairs to subscribe to rat backs from FBI. That's conversations that have been had in the past, but no movement. So
Nice.
the FBI results are only issued once at the time of application. So while the FBI results aren't all that reliable in the sense that not all states contribute to the FBI the same way, reporting the same information for the same types of crimes, it would be nice, to have a greater frequency of reports from FBI than just upon initial application, especially with traveling physical therapists and moving out of state, coming back to California, back and forth. So. The next bullet, all current licensees have been fingerprinted. The Physical Therapy Board has fingerprinted from its inception. Does the board check the National Data Bank prior to issuing a license? We give an explanation of the way we use the National Practitioner Data Bank and how Fsbpt provides a proxy service for us for that. And then also the reliability of the MPDB based on other states' participation. Primary source documentation, pretty straightforward. Question 22, addressing foreign trained.
Yeah, I like the bulleted format. Makes it really easy to read.
Question 23 may have been an issue for this board 7 or 8 years ago, but the way physical therapists have been trained in the military now adheres to CAPTE requirements pretty much anyways. So it's a little bit less of a concern for us. And then we also talk about the equivalency portion for physical therapist assistants. How we track veterans and military. And then for fiscal year 18-19, we talked about the number of our applicants that offered military education, training, or experience towards meeting the licensure requirements, and that particular applicant was issued a license. So just from that one application in 18-19, and I think the problem is pretty much gone away now at this point, that CAPTE has also taken care of what's happening in the military. It's not much of an issue for us. For BPC 35, we talk about kind of a more generalized explanation of how CAPTE has affected that for both PT and PTA. BPC 114.3 talks about any kind of revenues that have been waived for 7 licensees, but with no significant impact to the board's revenues. And then 115.5, we've expedited 62 applications pursuant to that particular code.
That's nice to know. I didn't know that. That's good.
And I think that number will climb a little bit as outreach occurs, as we've dedicated resources to the military desk. I think maybe some people that didn't know that could qualify for those kind of exemptions will.
And just that particular section 115.5 is specific to military spouse. So we do try to expedite any military applicant, whether they are serve in the military or a spouse. We try to make those accommodations, make it as easy as possible for them. But this particular section is military spouses.
I like it. I like that. I mean, it's 62. It's only 62, but it's 62. People are taking advantage of it, so that's good.
And then just a point of clarity, as Sarah said, that particular 62 are all military spouses.
And they already hold a license in another state.
That's
as well.
awesome.
Question 24 in reference to NLI. So for those licensees or applicants that have submitted fingerprints, but for some reason part of the process they've dropped out of the application or their license is canceled or terminated, we still file what's called a no longer interested with the Department of Justice, which is essentially unsubscribing to that person's fingerprints. 25, we go into examinations. We provide a brief description of the MPTE. And then we go into the California law examination, but we also touch on TOEFL, or a test of English as a foreign language. The last paragraph in TOEFL talking about the exemptions that were created in statute for those that had been awarded a bachelor's degree or higher in physical therapist education programs from a college or school, or received training in specified English-speaking countries. 26 speaks to the pass rate for the examinations, MPTE, over the last couple of fiscal years, going back to 17-18.
I think that first sentence in 26 belongs at the bottom of 25. Just the first sentence. It's asking, 25 asked, is it in another language? And I think it needs to be reworded. The NPTE nor the Cal Law is not offered in any language other than English.
I think it was from above.
We need to change the grammar of it.
Yeah.
Yeah.
Neither nor.
Or they're offered in English.
Yeah, only.
Yeah, they're only offered in English.
Do you have it? So we also have an amendment to this question that was provided to us by DCA, by the Office of Professional Examination Services, language that's specific to the general provision that we should be monitoring the occupational analysis for the national exam and comparing it to the California analysis. And so Brooke has kind of cut and pasted up there on the screen. When I received it from Tracy Montez, the way it's written, I would just include it as an addition. It was just an oversight on our part. Yeah.
Read it.
Yeah.
Business and Professions Code, Section 139 requires the board to, among other things, evaluate the licensure examination to ensure minimum psychometric standards are met and compare a California occupational analysis of the profession to the national occupational analysis to assess the validity of the national examination content for California practice.
Is that second part just saying compare the scores?
It's essentially saying that if there's an occupational analysis done on the national level,
Yeah.
you should also look to make sure that there's no large disparity between what the profession does on, as a nation as a whole compared to how it does in California specifically.
On the exam.
On the analysis of the exam.
Analysis of, it's the same thing.
Yeah, but I guess a good example would be there are some boards within the Department of Consumer Affairs that have California specific examinations because they feel, or through an occupational analysis, they've identified that the profession here in California differs greatly enough than it does from other states that they have to provide a California specific exam.
Okay.
My guess would maybe be contractors, where building code is very different in California than it is in other states, where a national contractor license would not be appropriate.
That's a really good example, but there are some healthcare boards that also have or have found a necessity to have California specific examinations. And there's even a couple that have recently removed their California specific examination because they've decided that it's an unnecessary barrier. second. I just wanted to make sure that I addressed all the edits. And Tracy is also the person that pointed out our membership or affiliation with CLEAR as an addition. So 26, what are the pass rates for first time versus retakes for the past 4 fiscal years? Thankfully, for Fsbpt and collecting this information, we can report it. When we did our research with some of the healthcare boards that went through sunset in the last legislative session, a lot of them reported that they couldn't collect that data wasn't available to them. They had a pass rate, but that they could not distinguish between first time or subsequent attempts.
So here at the bottom of the table, date of last OA. I do not see OA in the acronym list. And, when I see OA, I think of
Clinical.
osteoarthritis.
Occupational analysis.
Occupational analysis, okay.
But we'll definitely add it to the acronym listing.
If that's the only place that we find it, you should just type it out.
It's kind of riddled throughout this section, but we can definitely do that too.
So after the NPTE table, the National Examination table, we have the Cal Law table. And under the question, we said, please see table below. Maybe we should just make that plural. Tables below.
Should make that change.
Which one? I'm sorry, to spell out. Which one?
Tables instead of table, as we're referring to 2 different tables.
Yeah, let's see where we are with this.
Thank you.
5. We've got about 5 more questions until we end the section. Can we last until then and maybe take a little break?
Sure.
Okay.
Question 27. Are we all there now?
Yes.
Is the board using computer-based testing? We provide an explanation of how the Fsbpt is administered currently, going back to July 1 of 2011. And that no change has been made to the law examinations administration schedule. Are there existing statutes that hinder the efficient and effective processing of application and/or examinations? Staff and I tried to brainstorm this one, but it's really not statutes that we think are difficulties. Sometimes it's IT limitations and those kind of things. So we just said we cannot identify any statutes that hinder the efficient and effective processing of applications. School approvals, we provide the information for CAPTE and for PEACE, and kind of our caveats and carve-outs that while we rely on CAPTE and PEACE to do that, we could reserve the right to disapprove any school that CAPTE or PEACE has approved of. And that all of our schools currently are recognized by CAPTE.
We go back up to 27 and the paragraph, the second paragraph, prior to July 1, 2011. I'm I don't know that that even needs to be there. Because it's not part of this cycle. It's an old cycle. It's not really relevant to this cycle now. I would maybe just say that the Fsbpt implements fixed date testing.
Would it be as simple as just opening with the FSBPT administers the MPTE quarterly for each license type?
Sure.
So strike the prior, the whole
Yeah,
sentence.
just that whole
including prior.
sentence. Yeah. Because the 2011, it throws
Yeah.
a wrench in, and then it raises like, well, wait a minute, why did they change that? Is that a good thing? And
Although I would
then-
love for the legislature to cause us to apply pressure to the FSBPT to go back to continuous-based testing. But I get what you're saying.
Is that the goal at this point?
No.
Is
I
that
mean,
is that a goal at this point?
I feel like I got caught a little bit, but
Sorry. Sorry.
and I know they're listening right now, so that's fine too. So we'll strike that first sentence. And then again, are there any existing statutes that hinder the efficient and effective processing of applications? Oh, we did that one, I'm sorry. School approvals. How many schools are approved by the board? How often are approved schools reviewed? And we provide a current listing of the current approvals, a little insight into the process that we rely on CAPD for accreditation. Speaking to CAPD's requirement for an annual compliance report in addition to a more comprehensive report every 3 years that includes on-site inspection.
Is that true? Sorry.
It just seemed like an
What do you mean?
interesting question. Like, which part?
The very last part, the on-site, every 3 years, that includes an on-site inspection.
I think outside of a global pandemic, yes.
Oh, okay.
But I know that during COVID, they have been a little bit more hesitant to travel and have come up with some alternative means of doing some of these things telephonically and televideo. But for those involved in education, how often has CAPD visited the campus?
You talking to me?
Yeah.
Any of the,
2018 was our last visit.
Okay.
We were accredited for 10 years.
Oh, that was the accreditation visit.
Oh, sorry, yeah. Yeah, that was it.
Nothing intermittently? Nothing intermittently that I'm aware of either. But I'm a newbie.
And part of that was 2010, again, for purposes of accreditation.
I'll make a note to just kind of review with them again to make sure that it's still current.
Yeah, and that might be the intent,
I think that's also part of it too is, and I have found with CAPD accreditations that similar to kind of board's sunset process, that CAPD decides to come back sooner for those schools not participating as well and gives very long durations of time for those schools that they, can apply a high level of trust.
Okay. I know I said we only have 5 questions, but I think we might need to take a little break.
Okay.
So we are ending, we'll be picking up with question number 31. Okay. So it's 3 o'clock. What do you guys want, 10 or 15? 10? Let's say 3:10, and then we'll be back on record. Okay, thanks.